House Budget Committee will come to order. Madam Secretary, please call the roll.
Chairman Smith, Vice Chair Deaton, Representatives Meredith, Aldridge, John Black, Rusty Black, Bland Manlove, Boggs, Bosley, Burnett, Cups, Evans, Fischel, Fogel, David Gregory, Curtis Gregory, Hudson, Kelly, Lewis, Mayhew, McGaw, Nuremberg, Ritchie, Riggs, Riley, Roberts, Sander, Shields, Unsicker, West, Wyndham.
Okay, good morning, everybody. Today we have the Office of the Governor, the Office of the Attorney General, and we're going to finish up the Department of Social Services. So the folks from the Office of the Governor would go ahead and come forward. Good morning, Mr. Willard. If you would, please identify yourself to the folks at home and begin when you're ready.
Great, thank you, Mr. Chairman. Aaron Willard, I serve as the Chief of Staff for Governor Mike Parson.
Please proceed when you're ready.
Great, thank you, Mr. Chairman. I'll start actually just as you all have, I think, the budget books in front of you, starting from the table of contents. If you actually flip to the auditor and oversight reports, there is a reference I will make to some other changes that we have made. The last one that was done, you'll see, was in September of 2019. However, we have continued to make and follow some of the recommendations from the auditor's recommendations in her report, and I will get to those as we go through some of the other items in the Governor's Office budget. Next tab is the 22 pay plan. Obviously, this is part of the finishing up from the recommendation that was put forward in the past, and this is the allocation for that appropriation. The next item we have is the 23 pay plan, the cost to continue there. I think that this is in line with what you have seen and consistent with other departments and agencies across state government and the governor's proposal. The next two tabs are actually related just to the Commission on Compensation for Elected Officials. So these would be the items that are just related to the Office of Governor. And then we get into the Governor's Office budget itself. And this is where I did want to highlight some of the items from the auditor's report in the past. So when we had come into office, one of the recommendations was that there was a number of items that had actually been allocated across different departments and were allocated back to our office. And so one of the recommendations was that we needed to be more transparent in where this money was coming from. I think some of the members at the time that were on this committee, I think, actually had pointed that out. We have continued to follow that recommendation and really consolidate. So at one point in time, there was a large number of kind of money that was allocated from other departments back into the governor's office. We have continued to reduce that. And then the other thing that you will also notice as a part of that is that our office budget has decreased at the same time. So we're trying to be very conscientious in following those recommendations that were put forward by the auditor's office. Next will be the mansion operations, and I will just point out very briefly, I think that those costs have been pretty stable over time. We did have a period where there was some renovations that were going on over at the mansion, so the governor and the first lady actually moved out of the mansion and stayed over on the grounds of the National Guard over at Ike Skelton. There was a little tiny house that was over there that they stayed in for a time being. And then also during COVID, there obviously were not a lot of public events or any events that were held over at the mansion on that. And then finally, the one other item that I would point out to the committee is on the use of the National Guard. I know at different points in time we've had questions about utilizing the National Guard. Personally, I think, and some of you probably have that same experience if you've seen them around, an unbelievable group of people, an unbelievable asset and resource that our state has. We are incredibly proud. They have been called upon to do a number of things, whether it was helping in emergencies related to floods. We've also recently had some weather incidents. They were really, really instrumental in making sure that we were able to maintain some safety for stranded motorists when we had some extremely cold weather along our interstates. And then also with even helping on setting up different sites related to public health. So Really great resource. I would also point out, though, that one of the things that we do struggle with is it takes a little bit of time. These are people that have normal jobs, and it does take us a little bit of time to activate them when we call them in. And then also there is the federal government sets an amount. It used to be just under $10 million on the overall cost of an emergency, on whether or not they're going to end up picking up, the federal government would pick up the cost of that. That amount has increased, so it has gone up. It's over now $11 million. I bring that up just for the committee's awareness, so that sometimes when we do get questions about potentially calling in the National Guard, they're a great resource. It is also an expensive resource for us to use, depending on how many people we bring up. So I just wanted everyone to have some situational awareness on that, that if we do call them up, that is usually the number that we're juxtaposing against on whether or not the federal government will pick it up. So there is a little bit of a delta there. I guess that would be the point that I'm making. So,
Do we have a question? Representative Meredith, you're recognized for inquiry.
Thanks. So back on the operating, the governor's office, you did have a good bit unexpended in 21. You said you've been cutting costs pretty much in that office. Do you know where you're at with 22? Are you looking like you're going to have a similar amount unexpended?
So the other thing that we've had, I mean, so going back to the audits that we saw, and we really wanted to make sure that some of what was found in the audit report, to be honest, I mean, when we had come in, we were kind of unaware of how some of the accounting had been done on that. So we've really tried to clean that up. And as we were going through, we just had decided, look, we're going to get rid of those costs. We're not going to allocate that to any other department, and we're going to absorb those costs. So that is one reason they have gone down. The other reason is going to be, for us, the largest expense is going to be staff. And so we've also tried to be very lean with the amount of staff that we have. COVID was complicated for a lot of different factors, so we have been running. We probably don't have all of the positions that we have currently in our office filled. At some point in time, it would be nice to be able to fill those. So I think that actually it will be pretty close to what we have been utilizing. Yes.
So you think 22 as close to what you've been utilizing? I'm sorry. Do you think you're going to spend all the appropriation in 2021? $500,000, I think, went unspent. Mm-hmm. Is 22 looking the same way?
If we can fill all of the positions that we have, I think that we may not have as much that will be unexpended.
Okay, you still think you have the need for the full amount appropriated, is what you're saying?
Yes.
Okay, and because of circumstances right now, you might not actually end up spending it all, but you're trying to based on your need?
Yes.
Okay, thanks.
Okay, unless we had any questions about the National Guard section, I think that brings us to the Special Audits tab.
Yep. And if you also look on this was at one point in time, typically I think that this line has historically gone unused. It is something that is denoted, I believe it is in, we were just talking about this. I think it's actually in the Constitution. It's referenced that the governor will have the power to do kind of a special audit. This is a line I think that represents that. Often it does go unused. We have used it in the past, and what we primarily did was we did some cost sharing with another department that wanted to come in and kind of do an audit on the director's office. And so that's what the allocation was that was used there. We spent $15,000. I believe it was DPS was the office that we worked with on that.
Okay, any questions for the Office of the Governor? Representative Burnett, you're recognized for an inquiry.
Thank you, Mr. Chair. I noticed that there isn't an excellence coordinator position in this budget.
Say that again?
There's no excellence coordinator position, operational excellence coordinator.
Yes. So that is one of the things that's kind of allocated across a couple different pieces of our staff. So I do take on a lot of that role myself. I work directly with a lot of the cabinet officials, and then we also have another individual in our office that also kind of has the most interface with our cabinet officials.
Well, I was being a little facetious, but I mean, I would expect that to happen. It's a small office, and but what I do wonder is, the governor has requested those across all of the departments, and I'm wondering if is there a plan included in that the governor would meet with them, or that their work would somehow be then I don't know, coordinated through the governor?
Yeah, so I think what I would point out in those terms, there's the governor's office itself is only about 35 people, give or take. It's a pretty small office. So we're not necessarily in terms of, I think, the need for an individual position like that. We absorb that with the responsibilities of other people in our
Right.
office. However, what we are doing is we help set a lot of the direction, a lot of the priorities and things like that through a lot of the other departments. They have many more than just 35 people in a lot of their departments. And I think that's why we believe that there's an importance in doing a lot of the operational excellence. If you've ever had any exposure to some of the things that they're promoting, I think they're really good in terms of just creating a lot better situational awareness, a lot better thinking around problem solving, for a lot of
Right,
the
yes,
state
I
workforce.
do, I like the concept, I really do. I just want to be sure that it's used to its maximum efficiency, right? And I think that would include opportunities for them to come together and look at ways that we can streamline through more collaboration, more cooperation, more kind of interoperability, if you will.
So the other thing I think I would point out is during COVID, that was one of the things from the very beginning, I would say a lot of us in the governor's office and the governor himself have got an experience and a background working in the legislature. And one of the experiences I think that we've had is that there can be frustration around government being very good sometimes at creating silos. Departments don't talk to each other, divisions don't talk to each other, programs sometimes don't really communicate.
Exactly.
And so that was something we really wanted to promote, and I think that we've been very good at that in really trying to break down a lot of those barriers. A couple of the things that I would point out is that even during COVID, we had a lot of collaboration that was going across departments because we simply had some problems that we'd never seen before. Government has a huge number of assets and resources, and we wanted to be able to really bring those together. Another example would be the Office of Childhood. We had over 20 different programs at one point that were spread across different departments and agencies, and we really wanted to bring those together because we thought it was going to be a lot more efficient. So we've really tried to, instead of just talking about it and really doing it, but I mean, I think if the gist of your question is really about you want to make sure that we're really trying to prioritize that, I would assure you we absolutely are. I mean, I think that's one reason why we're asking for those positions, is to have somebody that is absolutely kind of dedicated to that in each agency all the time.
Okay, thank you. Thank you, Mr. Chair.
Okay, seeing no further questions, thank you for, I spoke too soon. Representative Wyndham, you're recognized for an inquiry.
Thank you, Mr. Chair. Good morning to you. A couple quick questions. What is the highest paid employee and the lowest paid employee in the governor's office? And then I'll let you answer that first.
I think that information, do you want me to read it, or are you looking at the information on pages 25 and 26?
Well, I find that 25 and 26 don't always tell the full picture on what the salary is. So,
Yep. So I believe myself is going to be the highest paid person in the governor's office. And then we do have, off the top of my head, I believe we've got a courier position.
well, I didn't want to make it so personal, but
Yeah.
what's your salary?
On page 25.
Uh-huh.
It's on page 25.
What's your position?
But you want me to read it on 25?
I wanted you to tell me what the salary is, what the number is for the highest paid position. and the lowest-
$148,470.
For the highest paid position, what's the lowest paid position?
Well, some of these, again, I mean, I think they're allocated as zero. That's not entirely accurate. There's a communications liaison position that's listed at $5,470, but that's also going to be considered, I think, part-time work.
That's why I asked for the salary, not what's on this page. So, I mean, if you have to give it to me later, then that's fine.
Okay.
but-
I think I see what you're saying. Yes, I can get you that later. And in terms of, you're talking about the lowest paid full-time.
Right.
Okay. Yep, we can get that.
And then my second question is: there's only one employee for the mansion operating expenses. Are the rest of the folks offender labor?
We do have, so the mansion is also falls under state parks.
Okay.
And so, because it is a historical building. And so there is, I believe, a couple individuals that are actually through the Department of Natural Resources budget.
Okay, and then has
But yes, the amount of the largest number of people that over there are going to be offenders.
can you tell me? And you don't have to tell me right now, but can you tell me how many hours how many hours of offender labor the governor's mansion uses, and then what would be the cost if we transferred that to Missourians doing the work?
I could get that. I mean, I think that it would. It's going to vary to some extent on the number of, during obviously COVID, that the need for that dropped tremendously when there was work going on at the mansion that dropped a lot.
I'm fine with the ballpark.
Okay.
All right. Thank you, Mr. Chair.
Okay, seeing no further questions, thank you for your testimony today.
Okay.
And up next, we have the Department of Social Services. I'm going to go ahead and try to catch up and finish these books this morning if we can. We're going to reconvene at book 3 of 7. Good morning. Please identify yourselves with the folks at home and begin when you're ready.
Good morning. I'm Kim Evans, and I'm the Director for Family Support Division.
Jerry Ann Yeagers, Branneke Department of Social Services.
Okay, let's jump right in. Thank you.
Okay, on page 444 is the program Alternatives to Abortion. That program is about $6.5 million. The providers are listed on pages 453 and 454. It promotes healthy behaviors, parenting skills, planning, housing assistance, and meeting basic needs.
Representative Unsicker, you're ready. You are recognized for an inquiry.
Thank you, Mr. Chair. What federal funds does this use?
This is out of temporary assistance for needy families.
Okay. Thank you.
All right, on page 455, we have Fatherhood Initiatives. This is a $2.5 million federal budgeted, and that has been recommended. What this does is helps with resources to connect fathers with financial assistance so they can, like establishing paternity and actively engaging them with the families. The programs that are included in this are on page 460 and 461. On 466, we have adult supplementation. This provides a monthly cash benefit to targeted individuals who are age blind and disabled. There will be no new cases added to this caseload, as it is part of the December 1973 programs for old age assistance. Right now, there is a GR of 10,872, and that has been recommended. You will see this program fluctuate as they would move to a nursing facility. They would move to the vendor care, and as they would come out, then you would also then see, they would come back into the program. And like I said, right now we are averaging about 198 folks in this program, so you'll just continually see that decrease. Oh, I skipped one, didn't I? Sorry. Oh, I thought we just did that one. I did that one. I did it, yes. Okay. All right, 474. All right, on supplemental nursing care. This appropriation provides a monthly cash benefit for those who are in the residential care facilities, assisted living, and the non-Mo Health Net certified areas of immediate care and skilled nursing. There is a $25.4 million out of GR, and that has been recommended. On page 483, we have blind pension. And this is assistance for blind individuals who do not qualify under the supplemental mental aid to the blind and who are not eligible for the supplemental Social Security income benefits, or SSI. And also assistance for blind who meet certain requirements with reasonable that meet the requirements for the supplemental aid to the blind. This is a $37.2 million, and this comes from the Blind Pension Fund. On page 493, you'll see that there is a request for an increase. This increase is $665,000. This is something that we are required to, it's a $15 a month increase from $750 to $765 with a maximum grant of $623. In Section 209040, the agency is required to request these increases. It was not recommended in the governor's recommendations.
Representative Unsicker, you're recognized for an inquiry.
Thank you, Mr. Chair. Do you know why this increase was not recommended?
Patrick Libring, Department of Social Services. I think long-term, when you look at the fund balance over the last few years, we've been really short and have had to actually borrow money from July 1st through November to cash flow it. We're just getting to where we don't have to borrow money to cash flow the program. So some of it is, I think, I don't know specifically. I know that's one of our concerns is we need a significant cash balance on July 1st just to make it through November when we get revenues. So okay. I'm guessing, but I don't know for sure.
Okay, thank you. Thank you, Mr. Chair.
Page 501 is the Community Services Block Grant. The department recommendation was $42,747,096. The governor's recommendation is $39,963,084. The difference in that funding is due to backing out some of the CARES Act funding. This provides funding to 19 community action agencies who provide services based on a community assessment. These services are centered around homelessness, employment, youth programs, education, and food insecurity. The providers are listed on pages 511 to 514.
Representative Nierenberg, you're recognized for an inquiry.
Thank you, Mr. Chairman. Good morning. Thank you all for being here once again with us as we have a little bit more time to go through this, I think, just more in depth and have a thorough discussion, which is important. One of the things that I've been trying my best to understand is the funds that have, especially with all the stimulus money. It's been tough, I think, to make sure that the money is getting used for the intended purposes, which I certainly respect the department and the willingness to work with us to help us understand that, because I had several calls about this. But I guess one of my overall concerns is that not all the money is getting out to the folks that need it. And so could you walk us through that? And this kind of falls into a few different areas, so I'm not quite sure where to ask this question. But essentially my overarching question is, are we using all of the money in time? Are we getting it to our community partners, or has there been any money that was left on the table? So if you could speak to that. Yeah.
I think she's just asking an overall question.
Yeah, it's kind of overall, and then it's on, I see it on this too, and sometimes I understand how, and I just flipped my page. Which page were we on?
We are on
to,
just a second.
or 501. Sorry, I flipped back. So,
So
if it's specific to CSBG, there's some funding left, but we still have time to spend that funding out.
Yeah.
So it's not like it's going back or lapsing at this point. It's just a matter of a lot of these are anywhere from 2 to 3 to 4 year grants.
Yeah, and I guess it's kind of the same thing that we were dealing with DESE. There's just so many different pots of money, and having a better picture of the timeline of how long we have to, when did those funds come in, when we appropriated them or allocated, I don't know if you all use that term, but when they were appropriated, and then how long we have to spend them. So if we can have like a better tracking document of that.
We've got a sheet that tracks when they've got to be obligated, when they've got to be expended. CSBG in particular, just be aware that a lot of these funds come with a lot of rules and regulations, a lot of requirements. So like CSBG, 90% has to go to the community action agencies. That's a piece that's done. There's a 10% discretionary where we've got some of that obligated. But at the same time, if you put it all out there and you don't have some left, if something pops up during this time, you don't have anything. So we know 90% of it's going out and has went out to those agencies. Now, one of the things is it's up to those agencies to then, the community action agencies to develop their own spend plans and distribute that locally. And so, that is outside of our control.
Sure.
Because this program is meant to be locally controlled to provide local solutions to local problems.
Yeah, absolutely. And that
so-
I
right.
certainly respect that. And so I guess that is absolutely the big picture question I was asking. And I feel like sometimes that gets lost in these individual budget lines and we see money there and get concerned, but then knowing that we have longer to spend that sometimes. But I think in general, right, that has been the overarching sentiment of the General Assembly is making sure that we get the money to the local folks who can use it.
Right.
And anything that sometimes with our lack of state workers, one of the things that I've been very frustrated with, I don't know what your guys' call time is in terms of your wait list or how long people have to wait on the phone for social services. I've heard some concerning numbers of how many hours that can take. Do you all have that number today in terms of average wait time?
You have it, or?
But that's been a huge concern. And so the folks that need it, sometimes they are getting so frustrated with our state bureaucracy, knowing that we have a lot of money, but they feel like they can't access it because they don't know how to. And so unless they reach out to our offices, and then we use between legislative liaisons and our legislative assistants to try to connect folks with resources, that's been a big frustration. So I certainly support getting them to our community partners. Whether it's, for example, TANF has been a really tough one because of the guidelines and wanting to make sure that people are using those funds correctly. But that's where I just ask, I guess my preference on those things would certainly be getting those more funds to community partners that can get for example, diaper banks that then can distribute those as needed. So anyway.
And so the call center we have doesn't really have anything to do with some of our CARES programs and things like that. That is the call center that you're referring to is more along SNAP or Supplemental Assistance Program.
But a lot of that still is impacted by the things that we see here.
No?
No?
No, they're kind of two separate programs, I would say, for the CSBG. Now, they overarch, like the local communities, you can use their CSBG to help those same people. But this is not like the food assistance program per se.
Yeah, but I guess what I'm saying is kind of the average Joe doesn't necessarily know that. And so they're directed to call Department of Social Services, and they work with your call center, and they don't know who they're supposed to be talking with. And so that's where I say that's the frustration that I hear from folks in my community.
Because they're trying to go through the call center to get to these other programs, even though it's not the same call center.
Yes, and so I think anything that we can do to share that information, even to make it more clear for, sometimes I say this a lot, but I realize how much I don't know about state government. And so that's why I've been grateful for honestly, for your department in helping to lead us through that. But sometimes, the more we know, that helps us educate others as well. But with that being said, what is the call center wait time right now?
I'm trying to look at the document here with my glasses. I think in the last couple months it spiked up, and this is on the SNAP. I don't have the contracted for the Medicaid with me. Those were lower. I think it was anywhere from 1 to 2 hours at certain points on the wait time, depending on what time of day. A lot of that is affected, number one, by staffing. I mean, we've had huge staffing turnovers. And with call centers, and Kim can weigh in on this, but you can't just replace the staff, have them sit on the phone and answer calls. There's a training period. They go through what's called a nesting period where they're answering calls, but they're not efficient. But we have a lot of things that we are trying to push forward to improve those. These were as of last fall. And we can get all these
I think that's helpful
documents to you to see all the different information on the call
that's
wait
with
times.
SNAP, and then what are we with the other call center?
The contracted one?
And I think it's important to understand that when we do have individuals on the phone, a SNAP interview can take us upwards to an hour. as we're going through and answering all the questions, depending on, the status and the number of folks in the household.
Sure.
So,
And are those scheduled appointments typically?
we can schedule, but typically they're not. We have an on-demand waiver that allows the individuals to call in when it's a good time for them to call in.
Okay, that was my question is, for example, like if they say, hey, like I know you all keep calling me back, but I'm at work, like I cannot answer the phone, I have a 10-minute break. And so can we schedule it,
Yes.
have some flexible time where the time, right, we're talking with many times the working poor. And so when they're not off until 7 p.m. or 8 p.m. at night, or God forbid they work the night shift, it's been really hard for these folks to be able to work with our system. And so that's the question is if there are some more flexible times where then they can call in if you have any of your,
We do, our call center, we work from 6 to 6. That is our core hours. Because of system limitations at night for the batch processing so that we're timely the next morning and able to access the system, we have to, staff cannot work any later than that.
Okay.
But we do offer
Now,
now.
are there any weekend?
No, we do not. At this time, do not have weekend hours. But what we do is we allow for individuals, if they're having, like you said, if they have very short time frames, they can set up an appointment where we would have a staff member available to them to do whatever they need to do, whether it was an interview or if they needed explanation. If available, our resource centers are available where we are actually doing the interviews there in the resource centers. If someone should come in, they can also set an appointment to come in there also.
Okay, and then for us, just to help with some information here, because this is something that my office has been doing a lot, is there a way where you can see availability of appointments, or we would just have to call and set that with you all? Is there any sort of, I think about a lot of different things where I can go on and say, hey, here's our availability for appointments.
So that is what we're working towards.
Okay, good.
So we are working on some new technology where an individual could go online or they could call a number where they could see the appointments we have available for each day.
Mm-hmm.
If they wanted to request an in-person, then it would be the location and they could look at the available appointments there.
Okay, I'm glad to hear that.
Yeah.
That's a huge thing. And I think a lot of, online booking and online things, that happens, a lot, that we can see how many windows there are in the availability so that folks know and they can use their time wisely. You all can use your time wisely and not everybody's just wasting their time sitting on the phone.
And right now, what they can do is on our website, we have a number where they can call to schedule an appointment. A lot of times, the technicians that are on the phone can resolve the issues that they have. They really don't need to come to talk to us, or we can resolve it right there. But we will set an interview if they choose to do so.
Okay, wonderful.
And so, I just want to remind everyone, when we're on the phone, we've sort of shifted the way we do work. We are actually helping the individual. So instead of an agent taking the phone call and just saying, okay, I'll have someone get back with you, we are actually doing that work on the phone. So that does take us a little bit more time. And the interviews that we're required to do by the Federal Nutrition Services, those can take upwards to an hour. So they're lengthy. A really easy one, someone, maybe a one-person household who's disabled, we can get that done in about 30 minutes. Initial applications take longer, and we've seen the increase in initial applications as we have gone through the pandemic. Folks who have never accessed our services before are now coming to us for services. And so just explaining as we ask the questions as we walk through.
Well, thank you for that explanation. If you all can share that too.
And then, on the contracted, and that's the Medicaid for the Magi, that call center, the average wait time is, for 21 was 16 minutes. Now, remember, average wait time.
But that's the entire year. So
That's the
I'm talking
entire
about,
year.
like,
I can
after
get the
Medicaid
actual last
expansion.
few months of you.
Yeah, that'd be
But just
helpful.
remember, even with average wait time, there's peak hours and non-peak hours. So when everybody calls in over the lunch hour,
Sure, that's what I wanted
it
to
jumps
see what
up,
your
and then you
longest
might get a
was
time where
versus-
it's only, a small window where you can get right in. So a lot of it depends on what time of day you call and things like that.
Okay,
So.
Yep, appreciate that. Thank you. Thank you, Mr. Chair.
Representative Meredith, you're recognized for an inquiry.
So how do 6-hour wait times happen?
Well, I'm not sure, and we'd have to go back and look at specific things on 6 hours. It all depends on when they call during the day. So remember, it's an average throughout the day or
But
average
that kind of
throughout the
covers
week.
the whole day, doesn't it? I mean, how many hours of the day do you have the call centers operating?
So we're open from 6 to 6. And like Director Lubring was saying, it is really specific to the call because we have researched some of the calls where individuals have called us, or we've received information from some of your committee members, and we've checked into these calls. Sometimes it is individuals will get on, they'll wait for an hour, they'll jump back off, they'll get back on again. You know, it just
I'm
varies.
getting screenshots of a phone call that is 5.5 hours and still going. They're not jumping off. They're just sitting there waiting for somebody to answer.
And I would be very interested, Representative, if you could share with me the information so that I could look into that to see the circumstances, because we do look into these cases. And some of the cases are Medicaid, some are SNAP.
This was Medicaid.
Okay, and so that we need to see what is going on with that situation, and what day did they call in? What we really dig into looking when you send those to us to try to resolve some of these issues.
Well, and we did get their issue resolved.
Okay.
But that's the person that knew to contact me.
Okay.
And all I can think is if they're sitting on, and I'm hearing anecdotally of other people dealing with these same kinds of wait times that don't know to reach out to their state rep in order to bypass the call center. So if our call centers aren't functioning, and you've got people that they can't do 6-hour wait times. So yeah, maybe they end up hanging up and calling back and hanging up and calling back because they could do 2 hours at a time. But that means they might not ever be getting through and never getting their problem dealt with.
Yeah. And Representative, there are other ways for them to access us too. And I do share your concern about this. As we have stated, we are short-staffed. Along with our vendor call center is like every other business is having trouble keeping staffing.
You think this does come down to staffing?
I think it's a combination. It's staffing. We opened up expansion. We opened up the applications July 1st. We were not able to process until October 1st. We started to see the influx in October. We hit open enrollment in November the 1st. And so it's just a culmination of things that happen, with staffing and with the expansion, with hitting open enrollment. We've seen the increase as individuals started to go back to work, and then we started to see waves of COVID again. We started to see the SNAP population start to fluctuate again. And for individuals who had applied early in 20 and 21, they're now coming due for their one-year research on the SNAP benefits. And so, folks, it is a large volume for us to have to process. And you have to remember that some of my staff that are processing Medicaid are also ones that I have to pull to the phones to help out and during those really peak times so that we can try to get those phone calls answered.
So folks switch in peak times to answering phones, and then in the non-peak times, they go to actually processing the paperwork.
Correct. And we're offering overtime to be able to try to process these applications timely.
Because maybe they can process them even when the call centers aren't open?
Yes.
Okay.
Yes. So we're trying to...
You're also contracting out some of these calls, right?
That's for Medicaid.
For Medicaid specifically. Well, that's where I'm hearing these wait times, honestly.
Yeah. And this is for taking... They take applications, they take reported changes, and then they answer general inquiry questions.
Are those outsourced call centers also understaffed, or are they able to staff up?
No, they have been understaffed.
Do you know what they pay?
I do not.
Do they cost you more or less than the in-house?
And I would have to do the comparison on that.
Yeah, I mean, that would be a difficult comparison because our in-house call center does SNAP. It's a totally different program, totally different requirements. You have the mandatory food stamp interviews. So
does your in-house not do Medicaid calls?
They will do high level, but I'll let Kim answer that.
We will if an individual calls in, and so let me step back just a moment. When someone enters into our phone system, there is an interactive voice response that asks them, are you applying, or do you have questions about Medicaid, SNAP, and they can choose that option. There are times when they have combination cases, or they're just going to pick any number they can to try to get to a live person, and so we will help them. So even if that Medicaid call is coming through...
You will help them if they get to somebody. I mean, seriously.
I agree. I mean, yes, we will help them the best we can.
But if they just start hitting numbers to try and talk to someone, that's going to go to an in-house person, most likely?
Yes, if if they do not choose Medicaid
But if they do
option,
choose Medicaid, they're going
going
to
to
a
the-
contracted
they
call
are
center.
going to the
So the
contracted.
ones that I'm talking about that are getting these hold times are contracted call centers?
It sounds like the situation that you were dealing with. Yes.
Well,
that-
and the probably 20 other people that reached out to me on social media and said that they dealt with it too. They were all Medicaid.
Okay. And so it sounds like they have taken the option for the Medicaid call center, and that if you could give me the information, I can tell you
So-
exactly which call center they went to.
When you have an average wait time that you're giving us, is that an average just for your in-house people, or is that an average for what the call centers that you're contracting with?
There's two different averages. One was for the 1 to 2 hours. That was for the in-house, the 16 minutes. But that was for all of 21. We'll get you and I know it spiked in November and December. I don't have those with me. But they were significantly higher, the average wait times for November and December when we had the
Just for those
increase.
months, but were they higher in those contracted call centers than the in-house?
I don't know that they were higher, but again, it's a different program.
Can you find that out?
Yeah, we can. Yeah, we can
And
look
get
at
us
those months
separate
and-
data on those contracted
We
call
can
centers?
send you separate data on the contracted versus, the
Okay,
call
and
center
who
for
oversees
November,
those
December.
contracted call centers? Who from in-house oversees the contracted call centers?
We do.
Okay. So you're getting reports from them on a regular basis as to what their numbers look like, because I suspect that it costs us more to use a private company to do a call center than to hire somebody full-time to do a call center.
Well, and I was going to say, Representative, we would need a significant number of full-time employees if we were to bring that back in-house.
Which it was how many years ago? Just a few years ago, right? We talked about this in budget a couple of years back when they got moved to being privatized.
No, so we
I
never
know we
really.
did for unemployment.
So if you want the history of the call center, like a long time ago it was privatized, and then went into in-house, and we weren't able to keep up with the calls either, and that would have been probably 14, 15 in that
Oh, okay.
area.
So it's
And
been
then-
privatized
So
that
where
long.
we went when 16 is we went to sort of bifurcated. Some of it goes to contracted call centers, and some of it goes to in-house. One of the things you'll struggle with to run these call centers is the peaks and the valleys.
Sure.
So you're going to have, like, if you try to staff up for the peak, you're going to have staff sitting around in the valleys. If you stack up for the valleys, you're going to have, you know what I mean?
Isn't that
So
true for these private call centers too?
Yeah, but they have more flexibility across different programs. They can, they may not just do, certain things. They can,
So they may have to be trained in 12 different things, so they're actually less prepared to deal with a Medicaid call because they
have staff
spending most of
specifically
their
with
day doing
Medicaid, but
something for
they have more
some private
flexibility.
company.
But I'd say they have more flexibility with staffing hours and how they staff. So they'll have more flexibility with, not really the number of staff, but how they staff, if that makes sense, on how they run their hours than we usually do.
Okay. I definitely want to see some statistics on how they're performing compared to our in-house. 16-minute wait time, I think we can tolerate that. It's still not ideal, but we can tolerate that. I would like to see what the range is, as was already discussed.
Right.
But I want to see how that compares to these private, the ones that are handling Medicaid patients. That's where the influx has been.
Right.
We've had an influx of Medicaid. Are we not keeping up with it at all? And then is that staffing at those call centers? That's the problem. You think it probably is?
I do. And you have to remember also, so they're taking an application. So they're going through every question with these participants on, and then also then if they call in for a change, then they're discussing whatever change has happened. And then if the individual's calling because a case action or they just really don't
Like
understand.
they just got kicked off and they're calling to try and figure out why.
Then that takes some time for the staff member to go in, look to see what's going on with that case. So, you're looking at anywhere from 30 minutes to an hour phone call if we have to do investigation.
Sure,
on
and I get
case.
the call being
Yeah.
long, but the sitting on the phone waiting to even have the call is what I'm trying to get through.
And I want to note, too, that in the early SUP, there is additional resources to beef up the call center that was passed out by the House.
Okay. And is that going to the contracted call centers?
Yeah, that would be contracted staff. We have internal staff to help do the determinations, the actual determinations, but there's contracted staff to
That's in the emergency sub
Contracted.
or the sub?
emergency sub.
The emergency
passed
sub
out
has
to help
support
with
not
this
just
issue.
for the in-house employees getting raises, but also increase in funding for the call center outside?
Yes.
Do
to
you
handle
think
the
that'll be
influx
enough
of calls.
to get rid of these ridiculous wait times?
I think the funding's enough. The staffing issue is a whole different thing that, that's more of a economic-wide problem.
Except if we're paying them enough, we should be able to hire them, one would think, right?
Yeah, I mean, I think everybody's seeing staffing shortages across the board.
Will there be more flexibility for the private call centers to do more significant raises to make sure that they're hired, that they're fully staffed?
They've got to be competitive. Right. I mean, they've got to be competitive, but they're also...
By whose standard?
Well, we competitively bid the call center, so it's not like...
We're not rebidding them after the sub goes out, right?
Right, they've got a current bid, so it's...
But we're giving them more money than they initially bid for.
To handle more calls.
Right.
Right.
So
right
are
now
they
you
also
pay
able
for
to
X
pay
number of
folks more,
calls.
or are they still having to pay lower wages and just try and find more people to staff them, but they can't do that?
Right now, it's still at the previous rate.
So they can't give raises within their budget?
They would have flexibility within their budget, but again, they only get so much per call or per staff to hire. And I would have to talk to the contractor because the private contractor
so
has their own
do you see where
rules.
I'm going with this? If the problem is that they're not able to hire people because they're not paying people enough, does that SUP money that goes to increase the budget for them allow them to actually pay people more so they can hire more, or does it just give them more money to have more workers, but they can't hire more workers anyway, so it's not going to matter?
I would have to go back and look at the contract, but again, they bid a price. They have to stay within that price. Just giving them more money doesn't mean we're going to pay them more per call. They're still underneath that current contract.
Do we need
You'd have to rebid the...
have something that allows us to increase that in an emergency way because of the cost of the labor changing?
That would be under procurement rules.
But if we were in-house, we could just give them raises, which is what we're
Through the
doing
appropriation
in-house,
process,
right?
yeah. Or
Because
if
our
you did it through a
in-house call
contract,
centers
you'd
will
have to
be getting raises. We know that,
Right.
correct?
Correct.
But now it sounds like they won't be getting raises if they're running the call centers that maybe have even worse wait times that are privatized because we're giving them more money to handle more calls, but not per call.
They do have the ability to give their staff raises. I want to be clear. The private contractor... we
But within the
contract
budget
with
we give them, and we're not
to
increasing
deliver a
that.
service, and we pay a set price for that service. So then it's up to them on...
But if we're not
their
increasing price per call that we're paying them, how are they supposed to give raises?
That would have to happen underneath the rebid.
So in other words, they're not going to most likely get raises right now, even though that's where the most egregious wait times are.
Representative Rob Nodell, Director, DSS.
Good to see you this morning.
Good to see you too, absolutely. I will give you a little bit of an update. Our primary contractor with the Medicaid calls has provided raises recently. They have. I mean, obviously that's how they run their business. I'm sure they've had to cut their margin probably to be able to do that. But we've had some very candid conversations with our contractors. I'm a very blunt person that some of the level of service that's been provided has been, in the opinion of the department, in fact, in a very strong opinion, unacceptable. And we've been having weekly interactions with that contractor, progress reports, and they have raised wages and staffed up. But within the current bid, within the current pricing structure that we're paying them for calls.
Okay. If you are having weekly progress reports and updates from them, can we have those current statistics of what they're looking like? It sounds like you should have them handy.
Yeah, I think we'll be able to get you those statistics and provide those for you.
Okay, thank you. And I do want to say, Director, thank you, first of all. You've been incredibly responsive and quick in handling these specific problems, and I do appreciate you even going the step further and trying to put a pause on some of the problems that seem to be wider ranging. So I'm really grateful for that, and I want to express that here because we don't always get that kind of responsiveness from folks that actually addresses the problem. This separate issue, I think, really does come down to we have to pay people more, it sounds like. And that's going to apply in all of these cases. I might see problems with privatization in the first place, but here we are. I guess what I'm trying to make sure is that we actually have a plan in place to get the raises where they need to be for all of these folks so that we can actually address this. Because as hard as you may try, having conversations with them, stretching their margins, making it where they can't make any money at all as a private entity doing this, if they don't have the money to pay their workers, we're not going to have the workers to fix this problem, right?
Absolutely, absolutely. And we've seen, as Kim said, with the increased utilization, and we've seen, changes in the way our consumers and our department serves 2 million Missourians. When you take across the broad spectrum of the service we provide, that's a lot of folks. And the way that they're choosing to interact with our department has changed probably over the past 2 years more than it has in a long time. And, and one thing that we try to emphasize to our team, it's not how we want to interact with our consumers, it's how they want to interact and are able to interact with us.
Can you elaborate on what's changed?
I think we've seen fewer, and I'll probably defer to Kim a little bit on this, but fewer in-office interactions, more desire to utilize technology, which we all know that state technology often lags the latest and greatest by leaps and bounds, but their desire to use technology, their ability to use that, our ability to, be able to upgrade in ways that keep the data safe and that encrypt information, but whether that's predictive dialers, whether that's chat bots, text message interactions, things like that. But Kim may be able to expound on that, but it has certainly changed dramatically, as people perhaps have not been comfortable going into an office visit because of COVID, sure, or people not being able to make calls at times that they previously could because their work life has changed pretty significantly. So, we're seeing that change, and it's our responsibility as a department to be interactive and to be responsive to that with the resources that you give us.
Do you feel confident in the requests you're making this year for significant IT upgrades to actually meet that changing demand?
We are, but I will be candid with you that we look at that continuously, and that answer may change next week. But right now, I think we're very comfortable and very appreciative of the request that we made, that the governor did put in his budget, and that this body seems receptive to funding.
Okay. Well, I hope we can address this problem sooner than later. It's, as you said, really unacceptable.
Unacceptable, absolutely.
Thank you.
Representative Riggs, you're recognized for inquiry.
Thank you, Mr. Chairman. I have 3 questions. Representative Meredith took care of my 4th, so thank you. That was about the reports. The first is, and if I miss this, I apologize, what percentage of the calls go through without needing a human response? And if you can make this available to the entire committee, I'd appreciate it. And you don't need to answer that right now. Second, what is the process for assessing how many of these FAQs basically can be handled through chatbots, whatever machine intelligence you're using? Final question is, how much of this system, if any, is cloud compatible to take care of these peak times? And if they're not cloud compatible, why not, and what's the action plan to get there? So I will be quiet. Thank you, Mr. Chair. Thank you all for being here today.
Representative Unsicker, you're recognized for inquiry.
Thank you, Mr. Chair. A couple follow-up questions. For your contract agencies that you work with, are there metrics that they're expected to perform at?
Yes.
Okay. Is one of them the wait times?
Yes.
Okay. Have you done anything with the contract when they're not meeting those metrics?
So this all started around October. When we expanded and went directly into the open enrollment. We have been working with them and having very frank and hard discussions with them. And so they are putting steps in. They were putting steps in place to mitigate this. They're constantly hiring, trying to get folks trained, but and trying to meet that need. So we have been working with them. We're all in a very unusual situation right now.
So for these Medicaid calls, what's the percentage of calls that get dropped or never answered?
So we can provide those metrics when we provide the other metrics of, what the drop rate is. Now, we, along with the wait times, and I think that'll answer your question.
Okay. And how would a family inform Medicaid of a change in circumstances?
So they can come to our resource center and report that. They can email we have email information out there where they can email the information. They can scan us a document. They can go on our website. We have a fillable PDF form that when they complete the form, they hit submit, it goes right into our workflows. And then probably the least favorable right now is going to our call center. But they can drop that information off. They do not have to stay and talk to anyone. They can actually drop that information off or mail that to us. We just need the information that has changed within the household.
Okay, and would that include information that a baby was born and needs to be put on Medicaid?
Yes, and we work very closely with our hospitals. So a lot of times the hospitals are reporting those newborns to us within, we've had the least amount of time was 2 hours that I know of that a hospital reported a newborn. And then we have staff that are dedicated just to the newborns and adding those children. Now, if they are at a hospital or a clinic that does not report, the family, it would be good if they didn't, if they've not received some information within 7 to 10 days of the birth of the baby, just check to see if that information got to us from the facility.
Okay, what's the average processing time for an application for a newborn?
So for a newborn, once we're notified, we try to have them on within, right now it's, with the staffing issues, it's taking us 7 to 10, but we try to do it within 24 hours.
Okay.
And then we work with the hospitals and clinics very closely when they have emergency cases that we have staff that are dedicated that we work those emergency cases immediately. It could be a child that's needing medication or a parent that's needing medication, a pregnant woman in crisis or a newborn that's in crisis. And we're making sure that we're addressing even the age blind and disabled population. We're making sure that we take care of those cases when necessary.
Okay, because I understand that there are babies that are losing Medicaid after 30 days. They're not getting on because of processing time. This is what I've heard.
Yeah, Representative, if you can get me some information on the, if you can get some specific information, I can check those out. I have not heard that yet, but I would appreciate it if you'd share that with me.
Yeah. And then you put a pause on looking at LexisNexis data for some applications. Is that for all applications?
So we have put a pause right now on the out-of-state addresses. We're doing a very deep dive, and I've spent the last couple of days just really combing through, working with LexisNexis on this information to see where, and we're using some of the cases that we have found where people have reported to us that they did not feel that was addressed. We're trying to see what the indicator is that has made a connection that they were out of state. So they use name, Social Security, date of birth. And so we're still looking into that. It will, as Director Nodell stated, we're going to take till the end of the month. We want to make sure that we get this correct and that we're doing, what we need to and making sure that we are reaching out to the participant and taking the appropriate action.
And is that pause on all out-of-state verification?
Yes, unless the person calls us directly and tells us that they're out of state, then we'll go ahead and take that action because sometimes they may be trying to apply in another state, and we'll take action then. Or if we find out through their SNAP application or a SNAP case that they've moved out of state, they've reported there, then we'll take that action on Medicaid.
Has that pause impacted processing times?
No.
Applications? Okay. And the last question I have, does FSD run the welfare fraud hotline?
So are you talking about if someone is in the community, feels like someone's defrauded? Yeah, that is actually under legal services, but they work very closely with us.
Because I understand that their wait time is far shorter than somebody who's calling to apply for benefits.
So under the welfare fraud piece, they probably don't have as many calls coming in as we do.
Okay.
For the benefits and that kind of thing. So they would have a significantly lower number.
How many people staff that number?
I would have to check on that.
Okay. I appreciate that information. And, whether some of that could be redirected to help. reduce those wait times for people who really need services?
So with the SNAP program, the FNS requirements is that it has to be a merit staff, which is a state employee, who is doing the interview. So they would have to be under social services to complete the interview and then complete the approval or rejection of that SNAP case. So our SNAP interviews are really a large number of our cases that are coming through. And so, that's going to require state staff. They're not under the Family Support Division piece. They are under another division. And so, that would cause us some issues in the SNAP world. I appreciate, you thinking outside of the box and thinking of other things, but that is one of the things that we have run into with the SNAP program is that it does require, merit staff, and then also those reinvestigations. So when my yearly certification comes up, we're required to do an interview with those folks also. So that is driving a large number of the calls is when they have to do the recertifications.
Okay, thank you. Thank you, Mr. Chair.
Okay. We've taken a long, windy, gone down a long, windy rabbit hole here. We have one more inquiry, and then I'm going to ask that we get back to the book and move on. These are all very important conversations. Representative Fogel, you're recognized for inquiry.
Thank you, Mr. Chair. I'd like to go back to something that you mentioned earlier. So you talked about the relationship or the collaboration between hospitals as a provider and FSD. Mm-hmm. So my question is, or a model of care that I've seen that's worked really well is when a patient presents to a hospital, an FQHC, a rural health clinic, a community behavioral health center, and there's somebody in that space that has access to the FSD system that can meet with the patient and answer questions in that healthcare setting. Obviously, we know that not all patients who have Medicaid are actively seeking care, which is another conversation. But my question is, what else can we do between the relationship with the provider and the relationship with the department that would help offset some of the burden that the department is facing? I know my background is working at a health center, and a lot of times people's questions when they're calling in are very simple. They need to report a change. They have a question about the status of their application. Maybe they need to complete the whole application, but a lot of the questions are just very simple ones that I think could be handled at that healthcare provider level. So I know I'm kind of talking a lot, but my question is, what can we do to strengthen that relationship between the provider and the department? Are there things that providers are requesting to do or would be able to do to help offset some of the burden that we're seeing on your guys' side?
We appreciate the collaboration we have with our hospitals and our FQHCs and rural health clinics across the state. We have over 500 members that work with us. We are constantly training them as our programs change, where they can just take care of the minor things, things that, they can, some of the individuals have, some of the clinics have signed up to where they can go in and look to see. So if you were to come into clinic and say, I don't know if I'm supposed to report something, I don't know when my annual renewal is due, that they can do those minor things. They can look to see their coverage dates, things like that. We've also taught them how to help the individual apply online, and how to access the forms online in case the individuals have lost their forms. And so they're doing a lot of that legwork. I really appreciate all of the verification that they get up front for us and scan that to us. So that gives us what I call a full kit. So when our staff gets that, we have everything we need and we do not have to go back and ask the participant for any information. So it's just continued work with our providers and education so that they can help their participants. And we also work very closely with our community partners also so that they're helping individuals like our food banks, our different advocates that we have out there. And we work very closely with them to try to educate them so they can help us educate the public.
Great, thank you. And I think this is a good conversation to have. If we have providers who are willing and have the capacity to help offset some of this burden, exploring maybe additional responsibilities that they could take on or additional collaboration, again, to reduce those wait times and help alleviate some of the staffing concerns that you're seeing within the department. Thank you. Thank you, Mr. Chair.
Okay. So does that take us to 5:15 perhaps? Or we need to talk more about community services block grant, since it seems like we've talked about everything else but that. Okay, 5:15.
515 is the Emergency Solutions Grant. And right now, we serve as basically a pass-through to Missouri Housing Development Commission, and they are actually here to speak to what this grant does.
Thank you. Good morning, Mr. Chairman, members of the committee. Appreciate the opportunity this morning to talk about the ESG program. There's two pieces to this program: the regular yearly amount that we receive from HUD through DSS, and then the CARES Act piece of that, which are federal stimulus funds. So the regular amount, the regular yearly amount, varies anywhere between $3 million to $4 million. The CARES Act piece, the federal stimulus piece, is $28.3 million. So if you look to page 516, you see those amounts there. The ESG program is designed to provide homeless prevention services, rapid rehousing, emergency shelter, street outreach, and there is a network of not-for-profit agencies that apply to MHDC for these funds. What we did with the $28.3 million, the federal stimulus funds, we split that in half. We took half of that and distributed that to that network of not-for-profit agencies throughout the state. We took the other half and stood up a brand new program called ERAP, Emergency Rental Assistance Program, so that landlords could submit applications for those funds as well. We have fully awarded the $28.3 million. There's still some administration to do with respect to those funds. It's a reimbursement program, so as the state agent or the agencies, not-for-profit agencies, spend those funds, spend funds they already have, they submit a reimbursement request to us. We fund that. So there's still some administration to do, but we've fully awarded all of those funds. Happy to answer any questions.
Okay, seeing no questions, thank you for your testimony.
Thank you.
Okay, and so this is, as you can see in here, this is zeros on ours because it's being transferred to Department of Economic Development. On page 524, though, you'll see the CARES Act funding. That is still, there's a slight difference in there because of backing out some of the funding that was used. That will still sit with Department of Social Services because it came to us. So that is the same program he just talked about. Page 530 is food distribution. This is, hang on. This is the request, or the governor's recommendation is $5,398,210. This provides food banks funds for storing and distribution of food to multiple food pantries throughout, as thousands of food pantries throughout the state. Page 540 is the food distribution from the ARPA funding. That is also going to the food banks for the same purpose. And because we used it, what happened with that?
So you look on page 540, that request was not funded because we originally thought that was going to be ARPA dollars. It's actually CARES Act that the feds notified us, additional funding from the CARES Act. So if you go back and look at the core, you'll see the core, we originally had a core cut of $6 million going down to go down to 3.5. You'll see the core go back up to 5.2 because originally we thought the additional funding was coming through the ARPA Act. It's actually coming through the CARES. So we went back and the governor undid some of that core cut to keep it in the CARES fund and did not fund the ARPA amount. So it's just basically where that funding, which act that funding was coming through.
Okay, Mr. Lubring, you mean he did not recommend funding this?
He did not recommend the authority in ARPA because it wasn't coming in ARPA.
Yes.
They recommended
Okay.
the funding, but they recommended it in the core because it was CARES.
Yep, okay, I just want to make sure that it's a little confusing when
Right.
we, different terminology. So, yep, I think we're tracking with you. Thank you.
Page 547 is the Energy Assistance Program. There have been multiple changes to the program this year. We have increased the income level, the household level of income that you can have from 135% of the federal poverty level to 60% of the state median income, which just ultimately means more people qualify for the program. We doubled the amount of energy assistance that is available in each fuel type to the same amount. We also doubled the amount of crisis funding, which was $600 for summer. It's now $1,200 for summer. It was $800 for winter. It's now $1,600 for winter. And it is now running year-round. The program used to halt certain times of the year. Elderly and disabled could apply in October, and we'd run it through March. Now we're running it year-round. The governor's recommendation is $119,687,608. Page 570 is the LIHEAP ARPA, and you can see that both the department and the governor's is $93,459,077. Page 578 is Habitat for Humanity. That was $250,000 in both DSS and governor's recommendation. This is ran through St. Louis. It's Arches, the community partnership in St. Louis. They have done a lot of different things in this program, including education on home ownership. They're running a pre-apprenticeship program, and it's all about housing and learning skills to do those types of things. Page 585 is domestic violence. So this was awarded to the 65 contractors in the same manner that we have done in the past. And this is for shelters, overnight stays, emergency services, rental assistance, group therapy, counseling, and crisis intervention. And that is $8,716,524 in both the department and the governor's.
Representative Unsicker, you're recognized for an inquiry.
Thank you, Mr. Chair. What is the source of the federal funding here?
Okay, so you can see the general revenue, and then on the federal side of it, it's the Family Violence Prevention. It's FIPSA, FVPSA, and I can get you more on this if you need it. And there's also some temporary assistance for needy families funding in that. So there's 3 funding sources that run into this.
Okay, I'd appreciate a breakdown of that.
Okay,
more information.
no problem.
Thanks. Thank you, Mr. Chair.
Representative Mayhew, you're recognized for an inquiry.
Thank you, Mr. Chair. Real quick, and I apologize for having to step out, but on the, just real quick, on the LIHEAP and the LIWAP, does the check go directly to the provider or to the individual?
Okay, so on LIHEAP, as long as we have a supplier, it goes to the supplier. So we have 2 kinds of payments, and I'll try to do this as quick as I can too. But we have energy assistance payment, which is X amount of dollars, like $650. That will go to the utility company unless there's not a utility company. In most cases, there is a utility company, and then it will go to direct payment. On the crisis portion of it, that's different. That will always go to either like a direct repair to said company for like an air conditioner repair or furnace repair. Or
I'm talking about the water mainly.
Oh, if you're going to, so water, which we haven't talked about in here, but on the water program.
I'm sorry.
No, that's quite all right. On the water program, that federal rule is that it must always go to the water or wastewater company.
Thank you very much. Thank you, Mr.
Representative Aldridge, you are recognized for an inquiry.
So going back to, I think we're currently with the domestic violence. Could you just get me a list? I'm curious of the sites that like this funding go to, mainly in the St. Louis area. I know it's 66 contractors, and then they go to 84 sites. But like, who are those individuals?
I would be happy to follow up with that.
Yeah.
I have a list,
Yeah.
And so
Off
I'd be
the
happy
record,
to
that's
follow
fine.
up with that.
Thank you so much.
Mm-hmm.
And also similar to the same thing with LIHEAP.
You want a list of the energy assistance providers.
So you guys, so like for St. Louis, you would send it directly to like Ameren, and then they, okay.
So you want a statewide list of the LIHEAP providers?
No, I was just more curious, like what, like if organizations had, like Urban League or Heat Up St. Louis, like if they.
No, so what they're going to do in those situations is they will probably refer people to say, hey, this benefit's available, as they would with multiple other programs, whatever it is. And a lot of times on these kind of programs, sometimes these bigger cities have their own programs too, so they'll blend and braid all the different funding. But they would tell them, like, here's where you can fill out an application, online paper, and here's the organization.
Okay, well, we can follow up offline. Thank you.
Okay.
Representative Cups, you are recognized for an inquiry.
Thank you, Mr. Chairman. So I'm trying to make sense of this. I'm looking at the past years, and we've gone from 9 million or almost 10 million to last year 3.9 million, and we have what, 5-some million unexpended.
Which page are you on?
I'm on page 586.
Okay.
So what has changed? Why are we? Because if we.
Why did we get? Are you saying why did we increase the funding? Is that?
No, I'm saying why have we decreased the funding? We've gone from, in FY 2019, we went from 9.8 million. In FY 20, we went 9.5 million to last year, the actual expenditures to 3.9 million. And then we've got FY 21, we went from 507 unexpended to over 5 million unexpended.
I think there's a lot of different things happening in here. There was some additional CARES Act funding previously that was given in addition during 21, I think, and that shows up more in the VOCA line than in here. So some of those expenditures were covered under the VOCA line as opposed to domestic violence in 21. Because there were some restrictions back in 21 on the GR. Those got released, and then we put them back out on the street once those restrictions were released in 21. Right after, so basically,
We have a note here, an increase of 1.8 in VOCA funds.
right, so there was an increase. So we had a certain level. It dropped during the restrictions. Once we got the VOCA and the CARES Act money, it went back up. And the GR restriction was released. So if you're looking at.
There was also VOCA funding used to support.
In 21, we used VOCA in a different section to support these lines. So we had a GR restriction.
Is that the plan going forward or not the
That
plan?
GR restriction was released, so that's why it jumped back up to where it is today. So there was a GR restriction in 21 that was released. Then we released that money back out to the providers. In addition, during that time, we had additional VOCA funds that we used to help support those providers.
Okay.
So the problem is it's in two different sections. So if you look in this section, there was a GR restriction for a little while. By the time we got it released, that money did not get spent. But ongoing, that money was never cut from the core. It stayed in there.
Okay.
In this line.
We weren't, basically the support was not jeopardized or decreased. It's just that you guys were moving money around
Yeah, I mean, there was restriction, but they received the same, they were able to maintain their level of support and level of funding even through the GR restriction period till it got released because we had VOCA funds over here.
Did we do that other areas as well?
I don't know.
That's something I'd be curious about.
I mean, not as,
how that.
You mean as far as the domestic violence program?
No, I mean just how we choose to just use a different source to pay for it, I guess. Seems
Yeah, and again, that GR restriction was temporary, so it dropped and it came back up.
Okay, so we're going to expect this to have a V shape?
Yeah, it'll have a V shape and actually go back up further because we're getting a lot more funds through ARPA and, like I said, the CARES Act for this year and ARPA.
Okay, I'll follow up more about that later. Thank you.
Yep, I think it would be good if you all could help us with this, just to give us a timeline of the funding, the withholds, all of the ARPA money, I'm sorry, CARES Act money, how that all kind of came into play, and maybe a timeline over the last, what are we talking, 18 months here, 24 months or something like that. That would be helpful to illustrate how these moving parts have worked together. So, okay, let's move on. Thank you.
I believe we're on 618, right? 596. Okay, so this is also funding for domestic violence, and it is, the amount was $8.6 million, department request $11.2 million in the governor's recommendation. All ARPA. Okay, and that difference was based on how the funding came in from the ARPA money. And the allocation on this, it matches our allocations that we do with the normal providers, the normal percentages that we do. We can get the list, it's the same list of providers that we've been requested to give, so we can obviously give that list applies to both of these. Page 618 is VOCA, Victims of Crime Act. And the budget recommendation.
I'm sorry to interrupt you. I think we may have skipped a tab here. 607, emergency shelter, domestic violence.
Oh, I did. Okay, this recommendation from the department was $562,137, the same as the governor's recommendation. This provides the same services as the last two, including crisis call, hotline calls, community education, community presentations, and volunteerings, enhancing safety. So this is the same type of programming as was the last two tabs.
Yeah, I've got some questions about how these different lines work together kind of towards the same cause, and maybe how this is structured. So maybe we could talk about that at a later time, just talk about all things kind of VOCA related and domestic violence related. I would appreciate a follow-up conversation there. Thank you.
Page 618 is the Victims of Crime Act, and that has total department recommendation of $67,036,408, the same as the governor's recommendation. I believe we've talked about this before, but VOCA's been changed into a regional approach in the new bidding process, bid process. And that 7 regions that are very close to the coalition's regions, just ensuring that we get the same jurisdictions together. We are in the process. Right now there are extensions through the end of March, and then we are in the process of finalizing how those are going to get awarded and sorting that out.
Representative Unsicker, you are recognized for an inquiry.
Thank you, Mr. Chair. You said that this is changing to a regional approach?
Yes.
Okay, so I understand there were some concerns about that at the hearing last fall about doing the regional approach. Have you heard any concerns from providers about doing a regional approach as opposed to what has been done in the past?
I mean, I think there's always going to be concerns, and there's going to be, there's going to be people on both sides of that. I mean, we went to the regional approach because of, I believe, things that had come up maybe a couple of years ago in discussions, and making sure that we use data to ensure that services were provided. So that is why we went to the regions. That's why we use the Missouri State Highway Patrol data on victims by the various types and allocating that funding.
So for centers that are in or serve people from multiple regions, will they continue to get their full funding?
So right now, we have 195-ish bids in that have been reviewed. So will everybody get the funding they are requested? No. I mean, there's almost, I believe, $67 to $70 million in requests.
Okay. So not everybody's going to get funded through this approach then?
There is a bid process in which it's a competitive bid, as we're required to do, in which there are various scoring, and we will release all of that once we get that all finalized. And so there's various scores based on the review of those. So will ultimately, potentially, some people not receive an award? Yes, if they score very, very low, very low.
Okay, I'd appreciate some more information offline about this.
Okay.
Thanks. Thank you, Mr. Chair.
$631 is to assist victims of sexual assault. And this funding supports services related to rape and sexual assault, adult victims of child sexual abuse who are seeking services such as 24/7 hotline, advocacy, therapy, support group. These services cannot be provided under the other funding source because it is exclusive for victims of intimate partner violence. And that is why the funding of $750,000 is both in the department and the governor's recommendation. There's also, this funding is also to help clear the backlog of the rape kits. And this is the only state funds that can provide the support and advocacy to survivors. Clearing these, processing these kits and getting this done is extremely important to survivors. Otherwise, it can take a very long time for these to get processed.
Representative Aldridge, do you have a question? If so, you recognize for inquiry.
Thank you, Mr. Chair. Just curious why it's less money from previous years that we're asking for. I mean, it's not a lot, but I was just curious.
And we can lay that out with the timeline, what we were talking, or with the overall timeline, kind of like what we were talking previously with the representatives, how some of this funding was, there were some core reallocations, money that was funded in here previous years that was, like in 21 was core reallocation. And you can see kind of some of the notes at the bottom, page 632. There was a core reallocation. Funding was put in here and they got core reallocated to the VOCA section. So there's been a lot of movement back and forth between these and some of the other sections, but we'll put together a full timeline for everybody to see on that. So if you look at it, there was a core reduction of 250,000 GR in 21 and a core reallocation of 160,000 in VOCA. So we'll lay out all the different sections, kind of the interplay between them.
Thank you.
Representative Unsicker, you're recognized for an inquiry.
Thank you, Mr. Chair. I see that this provides services to people who are 14 and older. Are there services that DSS provides for younger kids who are victims of sexual assault?
Probably not so much in this section, but in some of the other sections, there is funding for child advocacy centers.
Okay.
Through the domestic violence section, through the VOCA section. The child advocacy centers provide that. And then also underneath the children's division is where you'll see that funding.
Okay. Do you know if Children's Division provides treatment services for child sexual abuse victims where the perpetrator is not responsible for the care, custody, and control of the child?
So if we provide funding for,
Provides treatment or funding for that treatment services.
I think it depends. For the child advocacy centers? That would be underneath the child advocacy centers and the children's division.
Okay, I can follow up.
And we can do, have somebody follow up with you on that.
Okay, thank you. Thank you, Mr. Chair.
All right, I believe we're on 640 now, blind administration. So this appropriation is for personal services expense and equipment and communication costs for both the field and central office in the rehabilitative services for the blind. The ask is $5 million, with $4 million coming from federal and $1 million coming from the general funds. On page 651 is the services for the visually impaired. And this appropriation provides eligible Missourians with the opportunity. What we do is we work with them to help them to gain employment goals and to live independently. There's a list of the programs on page 656 and 657. This is an $8.6 million request with 1.4 GR. 6.6 is from federal, and then the Blindness Education Screening and Treatment Fund supplies $349,000, with $99,000 coming from the Family Services Donations Fund. On page 663.
Representative Ehrenburn, you are recognized for an inquiry.
Okay, I had a question about this. So I have a constituent who is blind, who is, and we were working together to access some of these services. Readers for the Blind, we've seen this in a couple, I think this is also in DESI's budget, there was something for Readers for the Blind, but is this, when you say Readers for the Blind, this is somebody to read for them?
Yes, and we also assess for if there's any equipment that's available that that could be provided for them to be able to.
Yeah, and this is the one of those that I just really struggle with because of all the new adaptive technology, whether it's smartphones, reading out loud. I really hate that some of the things that I see continues to be just quite antiquated, quite frankly. And so I would really be skeptical as to why we're spending $500 for somebody to read out loud. I'm not saying, maybe there's some older folks who appreciate those services, which I'd assume. But I was curious as to if you could give me a breakdown of that number. And then obviously I understand if there's, those who are into their, 70s, 80s, 90s, probably appreciate that companionship and having somebody read to them and don't know how to access the technology. But for those in our population who are younger, that no longer continues to be a thing. And then the other part is what we have in terms of service animals. Is there any assistance for service animals? And partnering with, and then my question goes into some of the partnerships with Department of Corrections and some of the trainings that they've had in the past for service dogs in other states. I don't think Missouri's ever had like a guide dog program per se. We have therapy animals and things like that. But other states are doing incredible things. So my best friend had a very rare, went to Truman State. She's now the director of behavioral health for the state of Nebraska. But she had a very rare form of macular degeneration and is now blind. Her guide dog, there's a lack of guide dogs, and then they're using other states. A lot of times it is in Department of Corrections that they're training those animals, those service animals. But I was looking at your budget, and I don't see anything that is the next step in terms of really meeting the needs of our community that is blind
And Representative, I'd be interested in some of your very specific questions. So if you would like to send that to us in an email, then we can respond to some of those questions that you have.
Okay. Yeah, and then just for readers. We can follow up offline. So appreciate it. Thank you. Thank you, Mr. Chair.
Okay, I think that's probably a pretty good place to break here. We're going to come back after session, and we're going to do something a little unusual. We're going to try to fit in the Attorney General, who is here with us this morning, before we kind of reconvene the rest of DSS. That shouldn't take too long. So after we do that, then we'll come back, and I think we'll continue on 663 when we're back, and then finish out with DSS. So we're going to go ahead and recess now and be back after session. Thank you. House Budget Committee will come back to order. And like I said, we're going to move to the Office of the Attorney General. So when you all are ready, please join us. Mr. General, thank you for joining us. When you're
Thank
ready,
you.
please proceed.
Thank you, Mr. Chairman. Members of the committee, for the record, Attorney General Eric Schmidt. I thought what I might do is just highlight a few things and go through the budget quickly and, of course, answer any questions. But as far as some major initiatives that the office has undertaken, the Safe Kid Initiative, which we've informed this committee in years past, we want to thank the committee for the GR appropriation from last year so we can work to complete the testing on the kits to clear that backlog. There are about 4,000 essentially, and we're 2,743 kits in. So we're making real progress there, and 115 police departments have so far cleared their backlog of reported untested assault kits. On the human trafficking front, in 2021, there were 3 operations that resulted in the rescue of 62 victims and 105 arrests. One of those, Operation United Front, Missouri led a multi-state coalition that led to 102 arrests across 12 different states. So we will continue those efforts. The Safer Streets Initiative, which has been something we've talked about before, to date, in that partnership with the U.S. Attorney's Office, has netted over 650 charges against nearly 400 defendants, and we have a 98% conviction rate. And then we've, of course, got the consumer protection section and Medicaid fraud, and have fought back against government overreach. And most recently, Missouri led the states moving forward to push back against the vaccine mandates. That was successful, a 6-3 decision on the OSHA mandate at the Supreme Court, and this CMS mandate is still pending. So obviously there's a lot of those cases if folks want to talk about it, but Missouri's leading the charge. As far as our core operating budget, you'll see on page 18, the total request is the same, 26+ million, the same as last year. There are no changes there, and this will be consistent throughout the presentation, that the only NDIs are from the governor's, the cost to continue the FY22 2% pay plan, and then the pay plan that's being considered before you now. So that is in the budget. So on pages 25 and 29, you'll see those on the core, and then the statewide elected officials on page 36. The core Medicaid fraud control budget on page 40 is the same. And then we've got the cost to continue the FY22 on page 46. And then the FY23 5.5% pay plan on 49, page 49. The core domestic violence, the SAKI, this is the Safe Kit initiative on page 53. There is that appropriation that stands there for the federal grants. There's no GR in there, it's just a pass-through. And then we've got on page 60 and 64, the governor's pay plan. The core Safer Streets on 67 remains the same, and again with the 2% and the 5.5% pay plan. And then on page 80, the core AG Trust, which is the same as it's always been. The antitrust fund transfer on 85 and the court cost fund transfer on page 89. And so that is a brief overview of the budget. Be certainly willing to answer any questions.
Thank you for that overview. We do have some questions. Representative Unsicker, you're recognized for an inquiry.
Thank you, Mr. Chair. To inquire.
Proceed, lady.
Good afternoon.
Good afternoon.
First of all, you mentioned human trafficking, and there were three
operations.
Operations.
Yeah.
How do those separate between labor and sex trafficking?
Well, there's a number of different fronts, and I guess I'll just walk.
Were they labor trafficking? Were they sex trafficking?
Sex trafficking.
They were all sex trafficking?
Yeah. Yep.
How much does the office investigate labor trafficking?
When we get referrals from the Department of Labor, we are happy to move forward on those.
Okay.
Yep.
How many referrals have you received?
I'd have to look. I don't know if we've had any, but we could follow up.
Yeah, I'd appreciate that
Sure.
information. And these were all sex trafficking operations. How many of the victims were children?
I can get you that information. I know there were victims who were children. And it might be useful just briefly walk through what we see. So our HOPE initiative, which is our effort to dislodge the illicit massage parlors, you see a lot of trafficking from Asia, specifically China, in networks that exist in every state, but certainly Missouri. And folks are moved around, not able to develop close contacts, taught to distrust law enforcement. Those are typically, the shades are drawn, you got to buzz to get in, those sorts of things. And so we're trying to disrupt that business model with our HOPE initiative. And we work with professional licensing to make sure those same folks don't come back and open up a new operation. A lot of what you see on the human trafficking front, we see from the southern border with the cartels really using their drug distribution lanes, and they have assigned zones and moving people across the border. $100 million a week is the estimate we heard from law enforcement down there just a few weeks ago. So that's obviously, and by the way, moving fentanyl now at an increased rate, and you see a 40% increase in overdoses. Then you have sort of the homegrown trafficking. And I think that's probably what we see more in some of these human trafficking raids recently. We had, for example, we were in St. Joe at 2 adjoining truck stops. And those are the situations where you see a mother trafficking her daughter, or someone who has a tattoo from her boyfriend that she's owned by this person and being sent out to, being taken advantage of. And we treat those, typically women, as victims. And so we have services available, counseling, making sure they have medical services available. So when we do this, we have a whole team, in addition to Highway Patrol, federal law enforcement, but also those victim advocate groups that have those resources. And that has really become a model. I mean, just recently, Alaska has reached out to us to see how we do it. Kentucky 6 months ago. So Missouri it's not very highly publicized, but Missouri really is a leader in when you do these things, what does it look like, and making sure that, like I said, women who are typically involved are able to be made to feel safe, that they don't have to go back to a situation, and that's why those victim advocate groups are so important.
Okay. Moving on to, you mentioned the Medicaid Fraud Control Unit.
Mm-hmm.
I understand that your office recently received or had a settlement, congratulations, in Medicaid fraud with a residential care facility.
Yep.
Are you investigating other or how did that come to your attention, first of all, that they weren't providing the services?
That one specifically, I'm not sure how that came to us, but we work closely with the U.S. Attorney's Office because there's a lot of overlap there with Medicare and Medicaid fraud. So our Mafuku unit works with them. We're certainly getting, it can be very data centric. We can get back to you on specifically how that one came about. But, we also have criminal prosecutions that are a part of that, but obviously those settlements or judgments are a big part of what we're doing too.
You mentioned that you went to Texas or to the border a couple of weeks ago. Mm-hmm. How many staff accompanied you on that trip?
0.
0. So it was just by yourself?
Yep.
Okay. Did you take paid time off for that, or did you go?
I'm always working, so.
Okay.
So I don't really have vacation time or.
Right.
Yeah.
And how much? Okay, and then I understand you're suing school districts over the mask mandate. How much have you spent on special process servers over that?
We could get you that number, but maybe a couple $1,000s, maybe.
How many staff are working on it?
We have 3 lawyers that are attorneys of record in those 45 lawsuits.
Okay. And is that the only thing they're doing?
No.
Okay. Okay. Thank you.
Thanks.
Thank you, Mr. Chair.
Representative Nierenberg, you're recognized for inquiry.
Thank you, Mr. Chair. Good afternoon. We're almost at noon. I guess still good morning. We got 2 minutes to go. So thank you for joining us today. It's nice to see you here in person.
Yep.
So I really appreciate your time on this. And, one of the things that I certainly have appreciated from your office is continuing to really track and bring light to a lot of the human trafficking that's been happening across our state, which is some of the most heart-wrenching cases, I think needless to say. So just want to thank you for all those efforts. And one of my questions was pertaining to trying to break down exactly how many attorneys you have working in the Attorney General's office. So when I was looking at your budget and FTEs, I wasn't quite sure, like in your core, how many Yeah, so if you could answer that, just how many attorneys you all have working for you?
Maybe Rhonda also can give a historical.
Sure.
We have approximately 180 assistant attorneys general and probably 10 others that are in management positions, so about 190 lawyers.
190 lawyers, okay. And then last year, I know that you asked for, I can't remember if it was an NDI or if it was just an amendment, but we added an additional $500,000 to litigate national, international causes. Is that correct?
Yes.
Okay. And then are you all using all of that? Did you
That was-
operate your office? Was it approved? I can't remember.
That was vetoed.
It was vetoed. Okay. So then is your office running under budget, over budget? I mean, obviously it can't run over budget, but you're running.
We are making do with what we've got. So,
okay.
Yeah.
So with all of these new things that keep, I mean, it is one thing after another. I feel like between the continuing to look into what's happening at some of our boarding schools, whether it's human trafficking. My question is, do you all have essentially enough attorneys in the Attorney General's office, or are you having to contract out any services because you're not able to handle that load within your office?
Yeah, I mean, the 500,000 notwithstanding, we're operating as we should. We don't hire outside counsel in those. Typically, a great example of that is on the opioid litigation. We handle that in house, and when it's all said and done, I mean, in one of the only couple states that did that. But when it's all said and done, that will be a huge benefit for Missourians, right? Because that's a lot of money we're not paying to outside counsel. So that is typically how we handle these things.
Okay, and speaking of outside counsel, when are you using outside counsel and what type of cases?
Conflict cases, that's probably it.
And then do you have essentially in your budget how much you're spending on outside counsel a year?
It's not broken down in our budget. It comes out of our core operating budget, though, unless it's a case of a legal expense, and then there's some costs that are accrued there.
Okay, so that's what I was just going to see if you all could follow up with me in terms of how that breaks down, because like I said, in your budget, it's not quite clear in terms of how often you're using outside counsel and how much they're getting and how much we're paying them. So that was part of it. And then my last question honestly just deals with, obviously you are running for U.S. Senate, and that requires a lot of time. And with that obviously comes a lot of press. How are you differentiating between campaign time and official office time? Obviously just, time all blurs together, but obviously we just recently had our Supreme Court ruling as to permissible uses of offices versus free speech as an individual, right? So how are you differentiating that time, and how are you making it clear when something is a campaign duty and when something is something of your official office?
I don't have official staff do anything campaign related. I mean, for me, I'm a candidate like all of you, right? You're probably going to be signing up here in
I'm
about
also
a week.
running for office, yes.
So I think we all find time to make sure we do our job that we were elected to do. But then if there is, an upcoming election that we're candidates for, obviously we want to be communicating to voters that way. So I stay very busy.
Sure. So let me give an example of something I was thinking of. When President Biden came to Kansas City in December, you wrote a letter to him. Was that campaign or was that official office?
I think that was an official letter.
Okay.
Yeah.
And so essentially fighting, the Biden administration in court, and then essentially, we're going to continue beating you. I think there was something that, we're not tired of winning yet.
Right.
Is that something that, did you receive a response from the White House, or have you been able to work with the Biden administration to save tax resources at all?
I mean, I don't think we got a response, but
did you send it to did you actually send it?
We sent it to the White House.
Okay, and no response. Did you all follow up in terms of seeing if there's anything that can be handled outside of court to save resources?
I think you probably have to give me some example. We'd love to continue to protect people's freedom and all that. The Biden administration, by and large, has had a different worldview.
Well, one of the things that you said in your letter is that, you are the Attorney General of Missouri. We have 6 million residents. I am one of them and probably differ on a lot of those things than you, right? I understand you have your role as Attorney General, but you also have to recognize that there's a huge swath of your population that is very supportive of a lot of what the Biden administration is doing. So with that being said, I know you're a dad to kiddos as well, and I have 3 kids that I've wanted nothing more for them to be in seat and in person. And so my question is, things like fighting mask mandates, there's been a lot of time and resources. And when it comes to the budget, just making sure that we truly are being fiscally responsible. And I recognize, there's certainly a time and a place to have your day in court, but I also recognize that that costs a lot of money. And so if some of that can be handled essentially through other channels, that was my
Well, on the mask
conversation.
mandates specifically, we did in December send cease and desist letters to all the districts that had forced masking policies. And many of them actually did drop their policies at that point. So we were hoping to avoid litigation.
I was going to say those without, not that all of them didn't have, some of our larger districts are able to handle that because they have counsel that are able to advise them as to what was permissible under that statute that we recently passed in terms of it can't be a health. And just to be clear, I'm not an attorney, so this is me as a teacher speaking and being able to read the rulings, but recognizing that there's a role for public health, but there's also a role for locally elected city councils, locally elected county commissions, locally elected school boards, and then that Cole County ruling was something quite different. So that's been the tough part where for example, the area that I represent, when they're saying actually we are a locally elected school board, and this is something that's always been permissible under public health.
Well, we tried,
and it has been codified in statute for quite some time. So I know COVID is new and it continues to change and evolve, and that's one of the things that's been so tough about it, right? We don't know. The science continues to change and evolve, and what could be. That's been the tough part of it, right? And so I understand wanting to make sure that we're following the rule of the law, and I certainly respect that. But I also see that this is taking a lot of time and resources. And being curious when we have really serious things facing our state like human trafficking, if we're able to spend the amount of time and resources to really combat those issues when we're fighting so much that has been governed or ruled by our local school district. So I don't know if you want to respond to any of that.
well, I mean, I guess I would say as the state's chief legal officer, we were making them aware that the mask mandates are illegal. And they had an option to drop it. Many did. And by the way, it's worth noting that 90% of school districts in the state have never had a forced masking policy. 90%.
Is that 90% of LEAs or 90% of our students?
90% of school districts.
But that number is quite different.
It could very well be, but it wouldn't change the application of the law. I'm just pointing it out that the district policies.
But again, the Cole County ruling did not apply to school districts.
Well, I guess if you want the shorthand version of it, the General Assembly has never delegated this authority to local school districts. Never, ever.
But with all due respect, that has been in statute for quite some time.
No, there's nothing in statute that authorizes
when it
them
talks
to.
about public health, much like
They can assign parking places, and their defense so far has been a general defense that school districts have authority to assign things like parking places and pencils. There has never, ever been a delegation from this General Assembly, ever. And by the way, I welcome a vote on that. If they're so confident, I welcome a vote on that this year, actually. But there's never been that delegation to, first of all, to quarantine healthy kids. School districts have never been given that authority, and they've never been given the authority to force masking.
So those are quite separate than what I'm talking about. So, and I don't have it in front of me. I didn't come with if I knew we'd get into this, I would have. But I'm thinking of the part that for quite some time talking about, more than 100 years ago. Obviously, we've been a state for 200 years. Public education has always been a cornerstone of
course,
not just our state, but of our democracy, right? So when we started looking at, the cases from long ago, much like our kids have been vaccinated for quite some time on measles, mumps, rubella, all of those things, when it looked at meningitis for a long time and recognizing if students are going to be in public housing on a campus, that meningococcal, I always forget the name of that, but the meningitis vaccine being so key to making sure that our students are safe and something that's preventable. So I know that's kind of a different conversation than this. Again, like I said, I really respect the science and how it continues to change and evolve and making sure that we are staying up to date with the latest information. However, that's why I felt like that is so important to leave those to those locally elected school boards.
Sure.
So that 90%, just to respond to that, 90% of our districts, of our 500 plus LEAs, is quite different than the amount of students that have been under a mask mandate for the whole time. And with that being said, I've been very fortunate as a member of this body to make sure that my kids have been in seat the whole time. And so even I was a teacher up through December of 2020. I wanted nothing more than our students to be in seat, because I know that learning is best when you're in person.
Totally agree.
That is just one of those things where I said, whatever we can do to get back in seat as quickly as possible, because I think it's the right thing for the vast majority of our students. Not every student, right?
Well,
But the
those
vast
districts that
majority.
didn't have forced masking, they had the same interest, and they were able to stay in class too. And I would argue that the science, actually, if you guys want to get into this discussion, we can. I'm happy to do it. I do it all the time. I'm very passionate about it, as I know you are. And I certainly take my responsibility as Attorney General to represent everyone, including the people who didn't vote for me.
Sure.
As you do as a state representative when you cast votes that maybe half your district may or may not agree with.
Yep, I'm in that
Right.
district where I say, oftentimes I'm one of the few where I had 800 people vote for Trump and vote for me. So I'm very cognizant of that I represent people all the time who.
Yep, and you were elected
are
to
of a
come up
different-
here and
right,
voice your, yeah.
of a different persuasion on many issues. But this is one where no matter where you fall politically, one of the things that I heard giant bipartisan support was making sure for our kids were in seat and for a long
Yeah,
time.
but I think I agree, and I think the premise, though, is that masks are effective. I disagree with that premise. And I think, but the underlying all of this is that, for me, it's about parents and families being able to make these decisions as opposed to the government dictating that everyone has to wear a mask. Even though we know, again, there are severe mental health consequences that are coming to light now. So I care about our kids, too, but I know that suicide attempts for young teenage girls now are up 40%. I know the loss of learning, speech and language therapy visits are up 300 or 400%. There is a significant downside. So my argument is let parents weigh the cost and the benefit. And if they want to send their kid to school with a mask on, that's their decision. But if they don't want to, I don't think that we ought to continue down this road, because if that's the calculus, it's just never going to end.
Well, again, I had to preface my comments by saying I'm not an attorney. I do my best to stay informed. But I also would like to say that I really, while I am not a medical doctor, I have quite a few in my family, and I also continue to follow that science. And when I have folks who are experts in public health are sharing that information, I trust them, and that's what I appreciate.
Well,
so
you
much
have more faith in the experts, because the quote unquote
But-
experts have been wrong
but-
for about 2 years now, and the goalpost keeps
Well,
moving.
Well, with that being said, that's why I so appreciate local elections, for folks to continue to be able to elect people that they want to govern them. And oftentimes we do find that all politics is local. And so that's why it's so important for those decisions to be made by our local school
Sure.
districts. And like I said, again, there's over 500 in the state. I recognize that those interests are vastly different. And I certainly am somebody who, respects where our family farm is up in Livingston County. That Southwest R1 school district with less than 100 kiddos is probably quite different from our North Kansas City school district.
Well, I don't think
that
the science
has
is any different, I guess, but yeah.
Gentlemen, with that
Yeah.
being said, it's just a different type of environment with how many kids are in every class and the activities. So when you're in a high school with over 2,000 students, you're obviously around a lot more people than if you were in classes with a small amount of students each day. So let's leave the science talk alone, and I'm going to leave that to the experts. But
Can I just address the local, I understand that, but I think it's important to know, just as the federal government is a government of limited powers that was created by the states, local governments are only granted they're political subdivisions of the state. So they've only been granted the powers that the General Assembly at one point gave them. And what underlies our lawsuits are two important arguments. One is that they've never been delegated this kind of authority, ever. And if they haven't, they don't have the power, even though they're locally elected. But just because a locally elected school board might want to suppress speech, they're not allowed to do that either. That's one issue. The second issue is that they're arbitrary and capricious, and that's where we get into the arguments, right, about science and whether or not this was reasonable or they went through the right process. But, central to this issue is whether they've been delegated the authority or not. I think and I hope the General Assembly, would address that issue. But in the lawsuit right now, the 45 lawsuits, that is the central question.
Well, with obviously we've had coronaviruses around for a very long time, and what we're seeing is that we're going to continue to have this.
Correct.
With different variants and things coming forward, right? And so my ongoing concern is with the Office of the Attorney General, if we're going to continue to spend a significant amount of time and resources to combating whether it's whatever you want to call it, dealing with COVID mitigation versus actually addressing a lot of very concerning things in our state, whether it's, opioids, whether it's human trafficking, whether it's, your office does a tremendous amount of very vital work for our state. And so that is my
And we're going to continue to do that. But I want to be fair, Representative. I will not rest.
Well, obviously.
Until these mandates are gone because they're illegal.
Well,
and they're wrong and they're ineffective and they're hurting kids. And so we can walk and chew gum at the same time. We're going to continue to do those other things. But central to my job is to protect the individual liberty of the citizens of this state. And this is, this has become a talking point, obviously, at the dinner table for everybody. But I've been very clear. I haven't, and I was elected, to do this job. And if people think there's somebody who can do it better and not focus on those things, that's what our representative republic is all about. Sure. But I am committed to it.
Sure. And with that being said, just honing back in on the budget, as this is the budget committee, if you could just send us a breakdown of the cases that you all are litigating in terms of how much it is has necessitated outside counsel. I think that's helpful I am a big fan of walking and chewing gum as well. And I know we all wear a lot of hats. I respect both of your official office and what you're doing in terms of campaigning and other missions that you see as your responsibility. But I just want to make sure that we are spending the amount of time that's necessary on some really important things. So I'll leave it there.
Thank you for your service, too.
Yep, absolutely.
Thank
you. Thank you, Mr. Chair.
Representative Meredith, you're recognized for inquiry.
Thank you. Good to see you today.
Good to see you.
Want to follow up on some of those questions. I'm going to start with the least controversial stuff, if I can, just so that we can get that out of the way. So trying to figure out your budget, and we've had conversations about this before. I have a hard time seeing what's allocated to what. And I think we asked last year for a sort of breakdown of that, and I don't think we really got one. Maybe that's because you didn't really think it was possible.
It's just, honestly, Representative, it's never how this office, we have people that we ask to come work in this office who do great public service. One of the benefits of that, I suppose, as opposed to being private practice, is the writing down point ones and point twos. So that's just not how we account for time. And that's never been the case, and it just probably, it won't be.
No, I
apologize, we can't give you.
Trust me, one of the reasons I stopped working at a big firm was the point ones and point twos.
Sure, it's one thing I don't miss at all from private practice.
I strongly agree with that. However, from a budget standpoint, I think it would be prudent for us to have a sense of how many attorneys are allocated to human trafficking, how many attorneys are allocated to each of the various to merchandising practices and consumer protection. You do at least have them broken down to some degree.
Yeah, we have lawyers in different sections of the office in civil and criminal. Absolutely.
Where can we see that in the budget?
We can probably give you some more information on it. It's not in the budget.
Right. We have our budget broken down. If you look up, we'll flip to the page, but you can see our MPRF budget is broken out. If you go
MPRF,
back. I'm
sorry.
Let me see here. I'm going to see if I can pull it up real quick.
Because I've been looking at the core operating budget.
Okay, if you look on page 4.
Oh, page 4.
And I'm going to use MPRF since you mentioned it. If you look about a third of the way down that column, it says merchandising practices. And you'll see that we have 39.5 FTE appropriated out of that fund.
Sorry, I'm not quite there.
Oh, sorry.
On page 4?
Yes.
Merchandising practices, 1.5 million actual dollars in 21. So here we are, 1.7 in 23 and 39.5.
Yes.
So then when you go up to the top to the GR one, what's in that bucket?
So that is our general revenue operating core that we get from the legislature each year. So
Does that include all the ones that are below it?
No. So that we have several different fund sources. So if you walk down through that list, you'll see we get some money from the Department of Natural Resources from specific funds to handle some of their litigation. We get money from Second Injury Fund.
Okay. The merchandising practices part, is that general revenue?
No, that's merchandising practices revolving fund. Those are dollars that are not general revenue.
Okay, so the roughly 40 FTEs that are there, are they the only ones working on that? Or do you have some that are funded out of the general revenue budget as well?
There would be a combination of.
Because the bulk of your employees are the GR, right?
Yes, that's correct. So we have several different fund sources. The bulk comes out of general revenue. And, but you could take our consumer protection division. That's where we use our merchandising practices revolving fund monies, along with some GR.
Okay. Do you know roughly how many attorneys work in the consumer protections division?
I would have that.
Okay.
I hesitate to guess.
All right,
because I don't wanna
that's
tell
fine.
you wrong.
That's the breakdown I'm looking for, though. If you could at least give me roughly how many work in each division, just so we get a sense of how you're allocating your resources between these various things.
Okay, we'll do.
Like, I'm really grateful for the work you're doing on human trafficking, but I also would like to see more, in some cases, work on consumer protections that I feel is sometimes lacking and has been for a long time, not just under you. I'd also like to know then, where do the attorneys, like the 3 attorneys you mentioned of record for suing schools, which department are they coming out of? Do you know the answer to that?
I think, let me see. I think they're in general administration. Yeah, they're in general administration, so.
How many attorneys are in general administration?
What do we have allocated? 20, 10? Probably 10.
10-ish, okay. Now, are those 3 of record the only ones in your office that are working on those cases? Or do you have other attorneys working on those cases, but they don't file the motions?
It could be that other lawyers are helping out with it, but those lawyers are doing the lion's share of the work on because it's obviously been a focus. So we want people who are living and breathing that every day. So yeah, they were doing the bulk of the work. It's not to say that somebody doesn't have a one-off, question to have answered or do some legal research. But yeah.
Okay, like any large practice. So 190 lawyers. So the rest of these FTE are just staff, like out of the 222, out of the 40 for merchandise protection. Of those 40 FTE for merchandise protection, do you know how many of those are attorneys?
I don't, but I can get that for you. I don't know off the top of my head.
Okay. I think you get where I'm going. If you give me a breakdown of staff, I'd like to see that. And then outside counsel, you said you don't think it's reflected in this budget in a specific line. Do you know, it's got to be in one of these. Do you know which it would be in? What the
come out of? I don't think it's specifically
It wouldn't be
designated.
specifically
Right.
designated here, but it would generally come out of our general revenue operating.
So it just comes out of the lump 12 at the top?
Correct.
Okay, and are you going to get us a more detail of how much you have spent on outside counsel in the last year? And can you let us know if any of those have been for reasons other than conflicts? So if there's a capacity issue somewhere, that sort of thing? Okay. Regarding the human trafficking work that you've been doing, you said you do your best to treat folks as victims when they are victims.
Yep.
Does that line get gray at all for you? I know that some of our statutes enable a lot of folks that are victims who are also used for crime a lot of times, particularly with drugs, to be prosecuted as well. Do you make a concerted effort not to do that? You understand what I'm asking?
I think I understand your question. Yeah. I think it's a cultural shift in how we view, for example, the women that would be taken to a truck stop, right, and being trafficked by a boyfriend or a mother. I mean, we saw that with her child in the back seat. We're viewing them as folks who are being taken advantage of, and so we are working our way to the folks. The focus of our efforts are to go after the people who are putting these, typically women, up to this. And those are where the arrests are coming from. I guess that's the best way to answer your question.
So you're not finding that you're making arrests on the lower level of this in order to get to the person that is actually trafficking?
It's not. It's not to say that they aren't being held. They're not being asked questions.
Sure.
And may not be charged if there's something else going on. But I was talking about the sexual act that's taking place in that vehicle. That is not our focus. Our focus is getting at the people.
So you're not prosecuting if it's sex trafficking, for example. You're not prosecuting someone for prostitution.
That's not really our focus.
You're
I mean,
looking to find out who's running
who's trafficking the people. Yeah, that's our focus of our human trafficking effort. We are
I
not.
appreciate that. Okay.
Yeah.
I'm glad to hear that. Do you know if the local local law enforcement that you're working with on this? I assume you're working with local law enforcement too. Are they on the same page
Yes.
generally with
yeah,
that?
and so usually, like, I'll give you an example. When we were in, was that Kansas City? Yeah, it was in Kansas City. The multi-state effort. You know, the local prosecutor was in the situation room with us, in contact with the local sheriff department and local police departments, the FBI, the other agencies, the Highway Patrol, of course. We're all working there in one place, and so we're able to coordinate, and we are in communication about, hey, this person's on the move. They're in a white vehicle. Is there somebody there with her? So there's a lot of like real-time analysis that's happening. Is this a victim? Is this a trafficker? And then those decisions are made with the locals. Because remember, we don't actually have the jurisdiction then to charge. We're coordinating the efforts.
Okay.
It's the locals that are ultimately charging.
But that 98% conviction rate is from you referring.
No, that's on Safer Streets.
Oh,
so on Safer Streets, our lawyers are charging and convicting.
Gotcha.
But on the human trafficking front,
you're just referring.
We're referring, and we are coordinating those efforts because it's a statewide office with those resources. We're able to do that in a way that the Buchanan County prosecutor really can't.
Gotcha.
So
okay, I appreciate that. The opioid settlement.
Mm-hmm.
Large amount of money, right?
Yep.
Good news, I think, overall for us. Thank you. Do you know which counties have and have not signed on to that as a part of it versus the ones that are pursuing separate remedies?
We are, yes. I think I have to be a little careful about what I say here.
We're not finished with that.
Yeah, right. But I can tell you, I believe we are getting close, and the goal here, of course, is to maximize the settlement to get sign-on. And
your goal is to get all the counties signed on.
Yeah, absolutely.
Are you able to tell us roughly where you're at in that
we
process?
We feel very good about where we're at right now. Yeah, and I wish I could. I
probably can't tell us specific
I do want to tell you more because it's good. I do want to tell you more because it's good news, and I love delivering good news. But
it's not finalized good news.
I just want to make sure, that we're not.
Okay.
And by the way, that's very important to maximize the settlement. So if we have everybody signing on, the way that it works is it's probably over $500 million to Missouri. Wow. If we don't do that, it's about half that. So,
if you don't have all,
correct.
If any one county isn't signed on,
if we don't have, that's part of the. In order to get to maximize the settlement, these are the terms.
Okay.
So,
if you're able to look into what you can share and give us an update on that, I would appreciate seeing that.
And I'm happy to do that.
I understand there may be limits on what you can share. Thank you. Okay, switching to.
Are we getting into the more controversial topics now?
Yeah, probably. I'm not. I really don't want to be spending this day fighting with you, so I'm not trying to go that road.
Well, you guys got to go home, right? Are you not going home? I don't know.
We don't really go home in budget committee. The court's ruling, the Cole Court, you know what I'm trying to say. Do you interpret that to mean that local health departments can't engage in mitigation efforts on a local level?
No, but it would depend on how they engage.
Non-COVID.
It would depend on how they engage. Because the Cole County, for the local health departments, that case stood for the proposition that essentially there has been no double delegation to unelected health bureaucrats locally, right? So that the General Assembly has delegated those health powers to the State Department of Health, right? There are obviously things that an elected public health board can do. What that decision was very much focused on was the what had been happening, which was the unelected folks in those health departments issuing orders.
So are you aware, I'm sure you are aware, that a number of local health departments stopped doing any mitigation efforts as a result of the letters you sent them? So they basically said, we're not going to do any contact tracing or any of this other stuff because they essentially didn't want to be sued by you or someone else.
There were a couple of counties I know on the days after the letter that we sent out that made that announcement as to whether or not.
Have you followed up with any of them to give them more specific guidance of what your office believes is allowable and not allowable?
I would have to check to find out if at that time we were contacted by them and if we did talk to them. But I think it's, again, you get into a little bit of a different scenario because those, we represent the state of, and we don't represent the local health boards.
Sure,
And
but
so
you give opinions regularly. Well, you're supposed to give opinions
Sometimes we do.
regularly. you tend not to when we ask for them, but
Well,
that
not
didn't start
sometimes.
with you.
Sometimes.
But I guess what my
we were
concern
trying
is
to
if you're sending them a letter telling them they have to cease something, and then they cease entirely out of caution, is it not your responsibility to also follow up and say, well, to be very clear, here are the only things I'm telling you that you need to stop based on your opinion as Attorney General?
Well, the purpose of that letter was, because it was a significant ruling, the purpose of that letter was to advise what the ruling said. As far as the specific applications for each one of those individual boards, that's probably not the business we're going to be in. But we did want to make clear what the ruling stood for, and that's why we got the letter out afterwards.
Okay, but no follow-up as far as
we might have. I'd have to check on that, but that's unlikely. I don't think we're going to be giving legal advice specifically to county boards.
I mean, isn't that essentially what you did when you sent them the letter?
Well,
you gave them legal
we
advice and
informed
said
them,
you have to stop doing this.
We informed them of a significant ruling that affects their departments. But as far as like how they're going to handle individual cases or scenarios, that's just not what we're going to get involved with.
A lot of folks
And by the
interpreted
way,
that letter as a threat.
Well,
based on your interpretation of the ruling, without any guidance on what specifically then was and was not allowable.
Well, to be clear, I think that the General Assembly is in session, and if there is to be clarification, this
putting a lot of faith in the General Assembly doing anything.
This
right
is the
now.
well, you guys are working.
And don't look at me.
Yeah, I'm not going to. But to the extent there needs to be clarification, I would argue, in sort of the way I view the world and the law, is this is the appropriate body to be doing that. Because
so maybe you shouldn't have sent those letters.
Well, no, that is existing law.
My point is, if you're going to go in and make a demand, then you've taken on the responsibility of giving them guidance as to what the law is.
No, we've told them that if they're engaged in certain activities or orders, those are illegal.
Right, but then you're not following up to clarify which activities you think are a problem and which aren't. Because if you're taking on the responsibility of telling them that, then you need to give them the full picture of what you're saying is and isn't.
There's a process by which they can move forward legally, but as relates to the school district specifically, there is no authority that's been granted to school districts to do this.
All right, I've been talking about local health.
Sure.
Before I switched to school districts, that opinion was very important, that court decision. Did you personally argue that case at all or represent the state on that case at all?
Not me personally, no.
Did you give guidance to anyone that was working on that case? Direction.
On that case?
Direction. To what the state's position ought to be.
We had a line attorney that worked on that unencumbered. If that's what you're getting at, they argued the state's position.
I am.
There was no direction to. They argued that case. That lawyer argued the case as the law sits, and the judge made a ruling.
Okay, I think you can imagine why I'm asking this. You know, as a lawyer, your job is to represent your client, and you have publicly opposed the state's position on that case, and yet your office represented the state on that case, correctly?
Yep.
So I'm concerned whether your office had any say in how you represented that case, or if essentially the attorneys that worked that case were walled off from you as you're publicly opposing what their position is supposed to be.
Is there a question?
Yes.
Because I think
were they walled off
actually,
at all?
I think if you should ask the question.
Was there any conflict of interest?
No.
With the office?
No.
And how did you prevent that?
The lawyer represented the state to the best of her ability.
Did you take any efforts to ensure that your public positions weren't influencing the attorneys that work for you?
My public positions are on Twitter. You comment on them all the time.
Correct.
So they're out there.
So you took no, because they work for you, right? You hire and fire those attorneys.
Yep.
So if they're hearing you very forcefully publicly saying that the state is in the wrong in this. Do you think there's any risk that they were concerned about zealously advocating for their client?
I don't.
Okay. Why?
Because that's not how our office operates.
Okay, but you took no active precautions on that front. Did you express to
I
them
didn't
that
argue the case, and we had a lawyer argue the case unencumbered, made the legal arguments. So, and by the way, the judge made a ruling, and it was a sound ruling, and we didn't appeal.
Well, we're going to strongly disagree about whether it was a sound ruling. Whose decision was it not to appeal?
My decision.
Your decision?
Yeah.
Because the department would have liked to appealed. Is that correct?
According to leaked emails, yes.
So the client, the state, wanted to appeal, but you, not the attorney that had been representing them, but you made the decision not to appeal.
Yeah, our office made that decision, but of course...
you're saying there was no conflict in representation?
No, listen, Representative, you know this very well. We represent the state, but I also represent the people of this state. So it's not as simple as your private practice scenario you're probably drawing up in your head. I represent the people of this state. And that decision was a sound ruling, and we made a decision not to appeal. And by the way, that's what attorneys general have done since the beginning of time. You can disagree with that decision, but it's completely appropriate.
I would love for you to give me some examples of other attorneys general who have represented the position that they did not agree with, publicly opposed that position, and then prevented an appeal from a case that they lost.
The office represented the state. The state lost. It is then completely our discretion to appeal or not.
Can you give me an example of another attorney's general?
We're happy to. I think on Twitter, Jane Duker was talking about when Jay Nixon did it when he came in office. There's all kinds of examples.
I'd be very curious
of
to see
not
that.
not appealing losses. Those are decisions
not
that are made all the
appealing
time.
losses that they publicly advocated they should have
Listen,
lost.
the reality is you can disagree with the decision, but it was completely appropriate.
I think I might disagree on whether it was appropriate as well.
Okay, good for you.
Okay, switching to the schools. You didn't, your letter that you sent to them, the lawsuits that you've filed against them, have not, correct, been based on that decision, that Cole County decision?
Well, the Cole County's decision stood for and highlighted the fact that those agencies or departments or whoever can only move forward on measures they've been specifically delegated to decide.
Did it apply to school districts?
A school district was not a defendant in the case.
Okay.
But it stands for the proposition.
Did it apply for school districts? Because it was about unelected boards, and school districts are elected, right?
Yeah, but the delegation issue is central. We highlighted that in the letter. If you read the letter, we were very clear about how it relates to school districts.
Was the case mentioned in any of the lawsuits filed?
That is the argument we are making, that they've never been delegated
But
the
was
authority,
the case
which
ever
is the
cited?
same.
Was that case ever cited?
I'd have to look.
Because it was referenced in the letter to them, but then
I'd have to look.
My understanding is it was not.
Okay. Well, whether it's in the filing or not, what I'm telling you here today is the reason why school districts don't have the authority, which was highlighted in the decision, is that it's never been delegated by the General Assembly, period.
Interesting. So can school districts require shoes?
I think, we can get into a bunch of hypotheticals, but
basic question.
Well, I mean, I'm glad you think this is funny, but dress codes.
It's not a joke.
No, it's not a joke, because there are kids right now that are suffering because of the forced masking policies in the schools. There are kids that have mental health issues now they didn't have before. There are kids with dyslexia that are further and further behind. So I don't find it funny either.
And neither do the local school districts that are trying to make tough decisions about protecting those kids as well as protecting the kids and the families of the people that are dying every day because of a contagious
I'm not
disease,
questioning the intentions. Right? I'm not questioning the intentions. I'm saying that under the law, they don't have the ability to do it.
My question for you is, under the law then, do they have the ability to require shoes?
I'd have to look at dress code issues. It's not anything I've looked at.
If shoes could be a part of a dress code, could a mask be a part of a dress code?
Masks play a very different role than a dress code. Masks, I've been told, are meant to slow the spread, which has been completely ineffective and debunked by science.
So even the science from the Department of Health and Senior Services that came out with a study that was, of course, leaked because they didn't make it public, that confirmed that mask requirements actually were reducing spread?
Actually, I think you're misinterpreting that study. That the story that came out of the Missouri Independent has been completely debunked. That actually
by whom?
That actually we provided data that shows just the opposite. that the school districts that did not have forced masking or the areas that did not have forced masking actually fared better.
Where's that data?
We provided it
Where?
at the time.
Because I've seen lots of data to the opposite, including what the Department of Health and Senior Services said.
Well, I'll give you another example. Blue Springs versus Lee Summit. One had a forced masking policy, the other didn't. Blue Springs didn't, and their case numbers were lower.
Well, but that's a correlation, not a study that actually looks
Well,
at
and
causation.
I'm glad you brought up studies. There has been zero randomized trials that would show forced masking actually works. You can't point to a single one, Representative, and I'll give you 2 weeks to try to find one. You won't find one. It doesn't exist. But what we do know is that there are severe health outcomes.
What we know is that there are folks that actually study this stuff for a living who are doing studies that are showing aggregate impacts of those things.
There's been
just
no
like
study-
DHSS did. Just like DHSS
That wasn't
did.
a study.
And concluded that
That
on
wasn't
the
a study.
aggregate versus an anecdote between
Are you
two
claiming,
districts that
Representative, are
you're
you claiming
pointing
that
at.
was a study?
I'm claiming that, yes, that it was
It
an overall
wasn't a study.
What do you call it?
There were data points.
Okay.
It wasn't a study.
Aggregate data as opposed to the anecdotal example that you just gave, I would say, especially coming from
No, but that's
experts
data. You
whose
understand
job,
that's data.
whose job is to actually look at these questions as opposed to just simply enforcing the law.
Parents, I'll give you an example. Parents can decide. If they want their kid to wear a mask all day long, they can choose that. The government should not be forcing 5-year-olds to wear masks. First of all, they don't have the authority to do it. And second of all, it's ineffective. And third of all, it's harming them.
Well,
that's science.
I'm not going to spend all day arguing.
I know,
this with
we can
you.
do this all
The-
day,
The
but-
fact is, local districts have a lot of discretion to make difficult choices. They're elected to do that by their local communities to make decisions about what that community thinks are in the best interest of their kids and communities. And I have a hard time understanding how a requirement of things like shoes, which schools have always done, how schools have always had policies about sicknesses and how to handle contagious illnesses, when to close, when to do all kinds of things, how this is suddenly different.
They've never had
other
the
than
ability at
a
all
political
to
issue.
force quarantine of healthy kids. They haven't. Never. I challenge you to find that.
I'm going to let this go for now. Thank you.
Thank you.
Okay. We've been on inquiries now for almost 45 minutes. I've got a few other requests, I believe. If you'd like to limit your questions as concisely as possible, that would be appreciated. And then we'll go ahead and move on. So, Representative Fogel, you are recognized for an inquiry.
Thank you, Mr. Chair. We've covered a lot of ground here today. Thanks for being here. My question is more specific to the budget and relates to the conversation that we're having. So just kind of quickly looking through the Attorney General's social media, press releases, website, it appears that we're spending a lot of time talking about the polarizing issues that we've hit on today, specifically related to litigation with our school districts and mask mandates. So my request would be, if we're spending so little time, what I'm hearing is 3 lawyers out of about 190 and a few $1,000s out of a $26 million budget. What I would love to see from the department or from your office is more of an intentional effort to highlight the things that we're doing well, or to talk about other issues that aren't specific to this one that's so polarizing. We all agree that it's an important issue, and regardless of what side you're looking at, I think we have strong arguments, and I trust that we're all in it for the right reasons. But I think when we're focused on the singular issue, and when I look at your office and what you're talking about or choosing to talk about, it does seem like we're focusing too much on one issue and not enough on all the other great work that your office is doing. So my request or my ask would be, let's see what we can do to stop talking about this one issue that clearly brings out the worst in all of us, and let's focus with your elected office on some of the great work that you're doing or other issues that we could be tackling, because I think at this point, we're past the point of repair with this conversation, and I know we've tread a lot of ground related to that today, but I would also love for your office and the General Assembly to be talking about the other issues important to Missourians outside of this one specific one. So that would be my ask.
Thank you.
Representative Bosley, do you have an inquiry?
Yes, thank you, Mr.
You're
Chair.
recognized.
So we've kind of beat the dead horse of the mask mandates, et cetera. Thank you for being here, first and foremost. I look forward to seeing you on the court soon here.
That's a different court. I can't wait to be on that court.
Yeah, so my question is more so around the conversation of the wrongful convictions with like Kevin Strickland and Lamar Johnson, et cetera. The position that your office took in fighting and litigating that they not be released, I kind of want to get a better understanding of that in sense of the budget items and what we did in doing that.
Sure. Obviously, this is a heavy issue too, right? Dealing with people's guilt and innocence. Our office is charged with all the criminal appeals in the state, and we have the criminal appeals division and a habeas unit. So when we're defending the convictions that took place at the lower court, we've got a team of serious lawyers that have been doing this for a very, very long time, including Sean Malcoprang, who heads our criminal division, as we defend those convictions. The same is true on habeas, as people are seeking a different kind of relief. I will say on the specifically on the Kevin Strickland case, you know, we operate in the new law that was passed. We operate in a adversarial system.
Which new law are you talking about?
The law that was passed last year that gave the
prosecutors,
local prosecutors, the ability to seek relief, which had not existed before.
Mm-hmm.
It is an adversarial system that we have, meaning even if somebody believes very passionately that somebody is innocent or wrongly convicted, you know, in court having to answer questions on cross-examination, those sorts of things is a very, very important part of our system. And that is the role that we played in that process.
So in saying that, if everyone is saying that this person is innocent and we need to go back and review the files, is it normal practice of the Attorney General's office to say, well, we're going to fight against the wrongful conviction? And then not only that, after this person with the bill being passed and legislation couldn't have been on the Attorney General's side to go and advocate for those changes in the first place, of knowing that the state has a history of convicting people wrongfully?
Look, this is part of the job that any Attorney General, it's a very important function. I would say that there had been a conviction, obviously, by a jury of his peers, and that no court had ever actually ruled on innocence or wrongful conviction until the Jackson County judge. That was a very new process, so the rules weren't exactly clear about what role we have that we typically would have in either defending the state's conviction or asking questions. I don't think we want to be in a situation, though, that just because a local prosecutor thinks that somebody is innocent, that there's no...
But if they found evidence, it's more of not a think, it's a no at that point.
Well, but that evidence hasn't stood up. I guess what I'm saying is that evidence hasn't stood up in court for a judge to make determinations on witness credibility, those sorts of things, whatever DNA evidence might come forward. I think it's very important to test those things and to challenge those things in court for a judge or a jury to make a decision. And that's the role that we've played for 200 years in the office, and it's the role that I currently play as AG. But I tell you that on a personal level, I mean, it's. I don't want to see anybody who's been wrongly convicted sent a day in prison.
And I get that you're talking about on a personal level. That's a different topic. But as the AG, as the person who's in the office currently, who was elected to be there, I think it's more so about the fact that we didn't do anything, you didn't do anything as the office goes to try to help offset this issue. You had to wait for legislation. You've been here for a moment, and you know, as you always talk about, you know, you come from certain communities and visit those communities where we see this happen on a day-to-day basis. Your office released the data of showing that minorities, specifically African Americans, are 98% more likely to be pulled over during traffic stops. So you know that there's a disparity there. My question is why didn't we, or why didn't your office use, or we're litigating a whole bunch of stuff, but this is about the livelihood of individuals. Why didn't you all come in a legislative aspect to come talk to the General Assembly and assist in trying to mitigate that problem early on? Like, there are many bills that are out here right now with racial profiling. Why aren't you all trying to push those types of legislation past the finish line in a budgetary standpoint? But then when you get on your social media after Kevin Strickland and whomever else has been exonerated, it's all, yay, look at what we did, but you didn't do anything.
Yeah, so I mean, obviously we weigh in on legislative issues all the time, and sometimes we take the position that the General Assembly, we will whatever is passed, I mean, that's what we abide by. And so, but there are certain priorities of the office. There are certain things we weigh in and don't weigh in on.
And I understand that, but I think that it should always be a priority when someone in a system, as you said, as adversarial as it is, when there is a mistake. I think, as you know, as a lawyer in an office that is geared toward rights of individuals and making sure that there's due process and making sure that people who have been wronged, we set them straight. I think that it was a missed opportunity. And not only that, I think that it was egregious for anyone to have advocated for the release or lack thereof, or the lack of release of anyone who's wrongfully convicted. And I would like to see from your department now, since that legislation has been passed, what are we doing? What are you all doing to try to help mitigate that issue now? And what are you doing in teaching your attorneys, et cetera, working with the individual county prosecutors to try to help with that issue instead of fighting against them when they're trying to release them? Thank you. Thank you, Mr. Chair.
Thank you, Representative.
Okay, I think that concludes our inquiries. General Schmidt, we appreciate your personal attention to our process and your indulgence amongst our members to talk about the wide-ranging functions of your office and your various positions on those functions. So thank you again for being with us here today, and that concludes our portion of the hearing.
Thank you, Mr. Chairman. Thank you, members of the committee.
Okay, folks, we're going to take a break, take a little time, get a breather, get something to eat. We'll be back, let's say 2 o'clock this afternoon. We reconvene with the Missouri Office of Prosecution Services at 2 o'clock. We are at recess.
Budget Committee will come to order, and we will resume with the Missouri Office of Prosecution Services. Please proceed, and if you have any opening comments, go right ahead, or if not, we can just get right into the book. Thank you for being with us today.
Well, thank you. I will honor your time. I managed to do this in 5 minutes or less in front of Senate Appropriations. We're not going to go through my whole book. The bottom line is that the core budget is the same as it's been the last 3 years. The only increases have been a result of the cost of living increases that have been recommended by the governor and passed by the General Assembly. So the real decision item I want to talk to you about is on page 124 of the budget, and I'll certainly be glad to answer any other questions you may have. But for me, the key and my respectful request to you all, as I did to Senate Appropriations this morning, is I need to add 2 FTEs. And I know in this environment that's not a popular thing, but it is a necessary thing. You know, my background, I spent 26 years in the Greene County Prosecutor's Office, the last 12 as the elected. I've run budgets. I did not ask for people I did not need. But I need this, and you can see the reasons I gave at the time I submitted the budget in October. I was asking for another Deputy General Counsel, and I was asking for a paralegal. And the reason is our responsibilities keep increasing. Now, probably most of you don't have a clue about what the Missouri Office of Prosecution Services does, and most of the time I'm glad just to fly under the radar, especially after what I witnessed this morning. But just keep in mind, I don't set policy. I run the Office of Prosecution Services. And in the early 80s, the Office of Prosecution Services was established by the General Assembly to service the state's 114 elected prosecutors and the Circuit Attorney of St. Louis. And our primary mission, I guess the analogy would be, MOPS is similar today to what would be Mary Fox and the Public Defender Commission. The Public Defender Commission basically provides for all the training, guidance, help, assistance for the public defenders across the state. The only difference is I can't tell all the prosecutors that are elected what to do. All I can do is provide the training. If you look at the statute, our primary responsibilities was provide them training and assistance to be competent trial attorneys, to be ethical trial attorneys, to establish a case management system that is implemented statewide. And I will tell you, we managed to implement statewide a case management system for prosecutors that was not funded by any general revenue of the state of Missouri. We managed to do it through obtaining federal grants. And during the pandemic, that proved helpful because our prosecutors were able to work from home, receive documents from law enforcement, review them, file them with the courts, and we still work closely with the courts. In addition to that, you know that other than probably the 8 to 10 large prosecutors' offices in the urban areas, most of our prosecutors' offices are one person, probably a prosecutor, maybe an assistant. So they lean on us. We, in essence, have become their general counsel, and I have a general counsel. We help them with HR issues. We help them with jury instructions. We help them with a variety of legal issues. We have prosecutors that help train them on handling child abuse and neglect cases and domestic violence cases, and we actually go help try them. Another key program, and then I'll stop talking about the program unless you have more questions about it, is that currently we have a federal grant that we administer that allows for victim witness advocates in 85 of the counties of the state of Missouri. Now, in the larger urban areas, they've been able to have victim advocates, but if we did not have this grant, the other counties would not have them. And we've been able to provide those to most of the counties, like I said, 85 counties over the last 4 years, continue to provide that. And for example, in the last quarter of 2021, those advocates helped service over 21,000 victims in the counties of the state of Missouri. So one reason I asked for these 2 FTEs is I need them because our responsibilities continue to grow. Unfortunately, OA was not persuaded. I don't know that they understand what lawyers do or what prosecutors do. But there's been a new event that brings me in front of you like I did Senate Appropriations. After I submitted the budget, it became clear that the uninsured motorist bill was going to be resubmitted. As you may recall, the General Assembly approved last year an uninsured motorist bill to try to reduce the number of uninsured drivers in the state of Missouri. It passed as part of a larger bill. As is usual, it gets to the governor's desk. He was okay with that part of the bill, but he vetoed it because of another provision of the bill. Well, the bill has been reintroduced. It's Senate Bill 783 in the Senate. In fact, I testified on it yesterday on behalf of the Senator Esslinger, and then House Bill 2170 mirrors it, filed by Representative Francis. And the key part of that bill is that the Department of Revenue will enter an agreement with my office to administer statewide the diversion program for the uninsured motorists, because the goal is to try to encourage people, a gentle nudge, to get themselves insured and avoid having to go to court, plead guilty, face up to a $500 fine, 4 points on their license, court costs, but to run a diversion program. It's based on a program that's similar to what's running in Oklahoma, run by that office that's equivalent to mine. And since they started it in late 2018, they have reduced the number of uninsured motorists in the state of Oklahoma by 100,000. So it's been a very successful program. But as I have indicated in the fiscal note to the House bill that's been filed, and as I testified in front of Senate Appropriations this morning, I can't run this program without these 2 FTEs. In Oklahoma, they have 2 full-time people running the program and 2 part-time people. However, I've been talking the last couple of years with the person that runs the program in Oklahoma. In fact, she used to be an assistant prosecutor in St. Charles County. I have the forms. I've looked at what they're doing. I don't have to reinvent the wheel, so I firmly believe I can run the program with these 2 FTEs. So I respectfully request, and I want you to also know this, I'm not going behind OA's back or the governor's back. Since we have learned that this uninsured motorist bill is going to go forward again, and that they expect us to run the diversion program, I've advised the governor's office of the change in circumstances, and they understand. I've advised OA, and I have tried to give fair warning to them that I'm not trying to blindside or ask you to do anything behind anybody's back. So that is my pitch and plea that you would approve these 2 FTEs, and I'd be glad to answer any questions about the core budget or anything else that you might be interested in.
Thank you for your testimony today. Questions from the committee? Representative Nuremberg, please proceed.
Mr. Chair, I think you were trying to dodge me. No. Okay, thank you for that really just brief summary. So I'm here on page 125 of the budget request, and I think what you are asking is a very reasonable request. So we're looking at $70,000 for a deputy general counsel and $40,000 for a paralegal?
Estimates, yes.
Yeah, it seems really low, but you can hire somebody for that?
Well, that's what's been typical in state government, all right? I have tried not to go beyond state government. We are having challenges filling, like the child resource prosecutor position we have. In the current environment, we're having trouble. I mean, you know that the legal, you're the former teacher, right?
Just a teacher, not an
No,
attorney,
you're not just a teacher.
No, I'm kidding.
My mother-in-law
Yes,
was a teacher for 30
very
years.
proudly, but I am the daughter of 2 attorneys, so I should say that,
okay.
who encouraged me
Well,
to go into education because of, making, anyway.
I believe that we can attract someone for that. That's in the range. Deputy General Counsel of State Government is sometimes somewhere between 65 and 70. I still believe that we can give it a go.
Okay.
And try it, because we have an incentive that the private sector doesn't have. If you come to work in my office and you would stay 10 years, you can wipe out most of your student loan debt under the public employee. Now that the federal government, under the current administration, is recognizing public service by prosecutors and by
Sure. Yeah, and
public
Director
defenders.
Fox kind of made that case the other day to us as well. So if that's the case, I think this is definitely one of those where it's a very good use of resources. So I sure, just for the record, just want to make sure that this committee would honor that NDI, as I think in the long run too that this would be another case where it will save our state money if we're able to pursue these things now. So,
Representative, I appreciate that, and like I say, I think we will reduce the number of uninsured motorists, and I would also point out that this NDI item is not being funded out of general revenue. It's being funded out of non-general revenue funds. You can see that most of my budget in the core budget, a little over $200,000 is general revenue, but the bulk of my budget comes from other fees and costs that we are allotted by statute and by federal grants. So we try to operate efficiently. Even though I've heard rumors that there may be a flush of general revenue money, I didn't even want to go down that road.
That is true. As of now, there's $2.9 billion in the state treasury. But with that being said, here we do have other funds as well that we can use. Can we honor those? Yes. But yeah, so if you think you're able to do that in your office with the 116,000 request, I think that seems pretty reasonable when, and we should be able to, I hope this committee will be able to get that done. So thank you for your comments. Appreciate it. Thank you, Mr. Chair.
Representative Burnett, please proceed with your inquiry.
Thank you, Mr. Chair. Can you, maybe you did already, but you piqued my curiosity with the other funds and how they're funded. Can you give just a brief overview of what those are and how are those funded?
Right. When the office was established in the early 80s, there were two primary funding sources. One was a surcharge on criminal cases, the completion of a case, and then the other was bad check fees. Of those two, the bad check fees generated the most money. I've looked at the history. About 10 years ago, bad check fee collection was generating for the office somewhere around $400,000 to $500,000. Today, it is nowhere near that. I mean, I looked at it. I think last year we made $48,000 in bad checks.
Don't write checks.
They don't write checks. So a primary funding source went. So the other funding source was the surcharge on criminal cases after conviction, and we were allotted. There was $1 assessed in criminal cases. 50 cents stayed with the local prosecutor for training, and then 50 cents would come to the Office of Prosecution Services.
And that was a court fee?
Yes.
Okay.
After conviction. And so for a while that funded the office fairly well, but by 2019, we were basically, I don't know that a state government entity can go into bankruptcy, but we weren't even bringing in enough money from bad checks and from the surcharge to basically pay two salaries. I mean, if we hadn't built up the reserve in the years that we had good years, we were in trouble. So this body graciously increased that fee from $1 to $5 in 2019, and $250 goes to the local prosecutor for training. It's their primary training fund, especially in these small rural counties. Well, you know how funds are short in small counties, and the other $250 has come to me, and it is generating, as we estimated, the budget people here estimated, and I estimated, it's bringing in about $450,000 a year. The rest of our funding is federal grants. The computer grant runs $400,000 or $500,000 over 2 years. And then
But those are dedicated funds for specific purposes?
The federal grants are for, yes.
The federal grants?
We get a traffic safety grant that's specifically dedicated to 2 prosecutors to help train prosecutors and law enforcement how to properly work and prosecute primarily DWI or under the influence cases. And they do that, and then the NARIP grants, or the computer grant, funds part of the general counsel's salary and full IT guy, because we administer the case management system for all the prosecutors in the state of Missouri. And that grant runs, like I say, it runs $400,000 to $500,000 over a 2-year period, but it pays for those positions and pays for us having this case management system and keeping it up to date.
Well, it's clear you have a really lean budget. I'm curious about the court fees. Where do those primarily come from? Is it for filing or for?
No. This is not a. This does not bar access to the courts. This is not a fee that's assessed up front on anybody. This is only court surcharge is assessed after a person has been found guilty or pled guilty and held accountable.
Then they have to pay
They
court
help-
fees. Do you know what the aggregate is on that?
Well, like I said, we're collecting statewide. My share is about 400 to 450,000 a year now.
No, I meant for the
For the defendant.
For the defendant.
Well, like I said, it's a $5 surcharge
for
each defendant. Doesn't matter what the case is. It's $5.
Are there other court fees in addition to that?
Oh, yes.
Okay, that's what I was asking. Do you know what that aggregate is?
You know, I don't. I know through the years that there have been efforts to fund other programs, like the Blind Fund is now a court cost surcharge. There's a variety of items that have been added as surcharge. For example, legal services. At some point in the recent past, this body added as a surcharge a surcharge for the legal services fund to go into it so that people could have access to the courts in civil cases.
Okay.
But I couldn't give you, you'd have to ask OSCA.
Okay. All right, I'll follow up with that. Thank you, Mr. Chair.
Representative Meredith, you're recognized for an inquiry.
Yeah, so I think some of this you covered. I just need to kind of walk through real quickly. The previous years, you've got unexpended funds. The federal, you're saying, is authority that you didn't end up having those grants. Accurate.
Right.
And then the other is we didn't have the revenue in those funds that are allocated to other.
Right.
Period. Right. Okay. You're spending all of the fund money that you're getting.
Well, except in the last few years, once again, like I said earlier, if we hadn't been saving some of the money up front, we would have been bankrupt. And I took this job in 2019. If I'd have done my due diligence and looked at the books, I probably would have gone somewhere else. But
I'm glad you didn't.
But I love my job. So to be honest with you, right now we have.
What I say about this job too.
We
if I thought it through and.
One reason I'm in a position to ask you for this is that we now have the money, and we have built up some surplus to fund these two positions out of that fund. And you're right. You see the high appropriations level. If you go back 20 years, we were spending near those appropriations.
Oh, okay.
But that's because we were getting grant money, and because, like I said at the time, I mean, the bad check was bringing in 500 to 600 grand, and then the court costs were bringing between the court costs and the bad check revenue is a little over $1 million.
Yeah, I mean, there's still authority for 1.6 in here or 2 million.
And we've been glad to keep that. If you go back and look at the budgets over the years, we would like to keep that appropriation authority in the event that we can qualify for some federal funding we're not aware of at the current time.
But the federal funding is probably more important than the other funding because those aren't going back up, right? So that could probably be lowered. Doesn't matter. It's authority. You did have in 21 86,000 unexpended in GR.
Yes.
Is that going to be true in 22?
Well, it gets back to the question that Representative asked
paying
me
enough
earlier.
to hire
We haven't
people?
been able to fill the child resource prosecutor position. The person that filled the position, in fact, I tried a case with her, child abuse case, before she left. She got a better job offer in Lincoln County as chief assistant. And we have struggled because the maximum salary I can pay that person is $72,000. And we have tried our darndest in this environment to hire. If the 5.5 thing goes through, it'll kick that salary up to about $75,000. And again, we're trying to promote it. We want the right person. You have to have a passion, as you know, to try these kind of cases. So we're not just going out and hire anybody. I mean, there's people that right out of law school we could hire, of
course,
but we're not going to do that. So we're still optimistic that we can hire that position. But you're right, we could have. We're almost we're into February, and the fiscal year ends at the end of June. We're going to have significant unexpended general revenue again.
So your budget request with this new item is really with the hope that you're actually going to be able to fill all these positions, but it's not inconceivable that it ends up lapsing if you're not able to. Is that fair to say?
That's fair to say of the surcharge funds. But I believe I've identified being optimistic, I believe I have identified a potential candidate to be Deputy General Counsel.
Great. So that one you think you already would be able to fill pretty quickly.
Right.
The paralegal, you think that's more competitive, you'd be able to hire?
Yes, because we're looking at state salaries, and I understand.
Yeah, sure.
But generally for this position, it's like 36 to 45. And so I think I'm in the ballpark.
I think so too. But then we don't know if you'll be able to hire the resource prosecutor, child resource
Child
prosecutor.
and we desperately need that person.
But you don't want to use that budget to fill these other two positions because then you don't have the ability to hire that person if you find them.
Right, and plus it's a different pot. It's general revenue. It's the limited pot of general revenue money that you allot. I don't want to go there. I want to keep that pot available for a child resource prosecutor.
Gotcha. Okay, and right now, do you have any paralegals?
No.
Because in here, it shows a paralegal with 41,000 allocated to it, but no FTEs.
Right.
So where's that 41,000 going?
Well, it's not spent because we don't have that position. We don't spend that money out of the surcharge. And don't ask me. Like I said, when I came in 2019 and I started looking at this, I'm thinking, number one, was I stupid to take the job given the financial situation? But number two, that I'm trying to figure out our budget. I don't know how that 41,000 got in there. We never had a paralegal. It's unfulfilled. So it's just money we don't spend.
I wonder if you'd be able to get essentially a budget request to us that you think accurately reflects what your budget ought to be, so that you actually have the FTEs lining up with the positions you're trying to fill and the dollars that are there for them. Because, I mean, I look at that, and if you don't have paralegal, why do we have $41,000 in a paralegal line? Looks like we should put the FTE there that you're requesting, and then figure out where that money is actually supposed to be going in your budget, so that we have a budget that is your budget.
Right.
It looks like this isn't, so it's hard to make the decision about adding new money to it if we don't know that the budget lines up with what's in front of us to begin with. Follow?
If the money's there, it's already being appropriated in that position. But we don't have the FTE for that position. So the money's is from the same pot of money.
Then do you just need an FTE?
I just need an FTE.
Because that request, that request is for $116,000 too, right? Plus 2 FTE.
The request is for the $116,000 with one of the FTEs being the paralegal. And
Right.
I have asked the same question you have of the budget people at OA is how do I fix that? I'm still struggling, Representative, on figuring out. I was a trial lawyer, right? I did do a budget in Greene County, but it was not as complicated as SAM2 in the state budget. So I'm like you. I've been trying to figure out how we can clean the budget, and that's one item I haven't figured out. If you notice last year, we took care, there had been some funds lingering out there, 100,000 transfer authority here and 100,000. I finally figured out those were from the past, and we eliminated them. If you notice from the budget, we worked with OA and submitted a budget that eliminated those transfers because they're not there.
Gotcha.
There's no money. I mean,
Well, I hope we can get you to the point that you're trying to get, but if we could clean up the budget so it accurately reflects your budget, that would be helpful in the process, I think.
we will try for fiscal year 24.
Okay.
Is all I can
This
promise you.
budget's not done.
I know, but the odds of me trying to get something done before you all
I mean,
act-
you don't have the time in your day when you're actually trying to run prosecution services and support prosecutors in our state with just a small staff. You don't have time to just go through and spend all your day figuring out a budget.
Sure.
Well, maybe someone here can help. So if we could have a conversation offline at least, maybe, staff in the House could help clean up the budget so it accurately reflects yours.
All right, that's fine.
Thanks.
Gentlemen, I caught the tail end of that conversation, but oftentimes we do kind of reorganize and clean things up through the legislative process. Perhaps we can work together to do that. So with that in mind, let's proceed. And by that, I mean we're done. So thank you for your testimony. Okay. And now for the third or fourth time, we have the Department of Social Services. And I think we have enough runway here to get this one done. So please join us when you can and remind the folks at home who you are, and we will resume when you're ready.
All right. My name is Kim Evans, and I'm the Director for the Family Support Division. And I believe we left off on 663, which is the new decision item for the Randolph-Shepherd. Thank you. All right, so this is a cost to continue. It's $3,198, and that has been recommended. What the Randolph-Shepherd program does is actually through the Rehab Services for the Blind, it allows those vendors to supply meal services to the federal government. And so we do have a contract with Fort Leonard Wood, and our staff are working there. So this is just a cost to continue. If we go to page 668, there is a $42 million federal ask and a budget, and the governor did recommend this. And this is part of what we were talking about with the blind vendors. The Department of Social Services, we contract with them. It gives them priority in these facilities, and it helps provide meals. And we have, like I said, we have entered into a contract with the Department of Defense for Fort Leonard Wood. On page 675, this is the Child Support Field Staff and Operations. And the Family Support Division operates the Child Support Program that promotes parental responsibility. And this helps with, getting support to help support the children. And it also helps decrease the need for other benefits such as temporary assistance. This appropriation supports the salaries, communication costs, office expense for our frontline staff and supervisory, and we operate 15 offices across the state. That is a $33 million ask. It is a 6.8 GR with 23.4 federal and 2.7 other, and that other is from Child Support Enforcement Collections Fund. On page 686, that is Child Support Field Staff and Operations. This is the Child Support Federal Grants. This is a charting a course for economic mobility and responsibility parenting grant, and this provides education to teens and young adults about financial, legal, and emotional responsibility of parenthood. And that is a $2 million ask from feds, and that has been approved through the governor's recommendation. On page 691, this is the child support reimbursement to counties. And what this appropriation does is the partnerships between the county governments and the Family Support Division to help enhance the child support services. It provides reimbursement to counties, including the City of St. Louis, for child-related expenses, and that includes things like establishing paternity, establishing support orders, and prosecution and enforcement of orders. And that is a 17.5 ask with 2.2 GR, 14.8 in federal, and 400,202 in other. And that other is from the Child Support Enforcement Collections Funds.
I'm sorry. Representative Burnett, you're recognized for an inquiry.
Thank you. Just real that parenting program, is that the program where the kids get the babies and carry them around and take them home? And
John, is that part of
the virtual baby?
Okay, no.
No, okay, thanks.
Representative Unsicker, you're recognized for an inquiry.
Thank you. Good afternoon. That Child Support Collections Fund, where does that money come from? Who pays into that?
So the Child Support Collections Fund, as we do recoupments on individuals, so for example, if somebody's been on temporary assistance for needy families, while they're on there, the department is also required to open up a child support case on that. So if we recoup child support funds while they're on TANF, the state gets to retain those recoupments. The FMAP portion, so around 65%, gets returned to the feds as required by law, and the state gets to keep 35%. And that 35% portion is what gets deposited into the CSEC fund. And so it's for programs like TANF, but it is also for like the 4E program, where by federal law we have to seek the child support, and we keep the state share, and the federal portion goes back to the feds.
Okay. I have some more questions about the 4E program.
Okay, on how that works? Yeah.
Yeah, how does that work?
What do you mean as far as?
Are parents charged child support when their kids are in foster care, or?
Yeah, to a certain degree. If a child is placed in foster care, comes in our custody by 4E regs, and I don't have those. You have that one pager on the response. I can get you the information. But we have certain requirements around seeking child support in those cases.
Okay, does that child support go back to help the individual child that it's collected for?
No, it's not similar to like Social Security, where when we get Social Security, that goes to care for the child. What it does is it offsets the state and federal costs from caring for those child. So I guess in a way, so like say if we collect $100 from those parents on that kid placed in there, we have to send $65 back to the feds. And so the feds take a portion, and then the state retains a portion, which is around 30. It's the FMAP rate, so depending on what the FMAP rate is.
Okay. So if the state collects Social Security on a child, does that parent still have to pay child support for the child?
I do not know off the top of my head if they, in that case, how that would work.
Okay. I have some more questions about child
We
support.
can, I can have some individuals. We do have a 4 unit that kind of works with that and initiates it along with child support and the lawyers. And how that program works, so we can do a follow-up meeting and make sure we have the right people there to answer that question.
Okay, thank you. Thank you, Mr. Chair.
Representative Aldridge, you're recognized for an inquiry.
Thank you, Mr. Chair. I kind of want to, I'd love to also talk offline. I don't want to be with this too long. I know we got weather coming down. But so from what the conversation kind of was saying when it comes to foster care, if they collect child support, it's not going to the child. It's almost like a fee that you guys use to pay feds and then take the rest of the money?
It's a federal requirement, and it basically reimburses the feds a portion, or basically for expenses spent on that child.
If they are in foster care?
Yeah.
Okay. I'd love to dig deeper on that too.
Yep, we can have that conversation.
Okay.
All right. So I think that takes us to page 701. So this is the distribution pass-through, and this mechanism allows the Department of Social Services to manage certain types of collections and support payments to families and other payees. This could include payments from federal funds, such as tax intercepts, and payments from the debt offset escrow fund. This is a $51.5 million federal, and with a $9 million from the debt offset escrow fund, and for a total of $60.5 million, and this was recommended. On page 708, then we have the debt offset escrow transfer, and that's 1.2 other, and that's coming from the debt offset escrow fund. This appropriation transfers funds from the debt offset escrow fund to DSS federal and other fund, and or the child support enforcement fund. And this allows the escrow fund to distribute any state tax intercepts to families and to return any intercepted income that should have been given to the families. And we're done.
Okay, seeing no further questions, thank you very much. I think we're ready to move on to Book 5 of 7.
And again, this is, we will have Scott Odom with the Division of Youth Services.
Good afternoon to the committee. Scott Odom, Director, Division of Youth Services. As many of you know, DYS provides rehabilitative services and education to youthful offenders committed to the division from the 46 judicial circuits. We are the deep end of the juvenile justice system in Missouri. We serve juveniles in the state with the most chronic and serious offenses and issues. Our goal is to assist these youth in becoming productive members of the community. DYS has been affected, as have all, by the COVID-19 pandemic. We've had to make quick and difficult decisions regarding the youth in care, our frontline staff, and program operations in general. Critical to the management of this pandemic has been internal efforts toward prevention and elimination of the virus within our congregate care settings. Aside from the health of our youth and existing staff, our most critical concern continues to be our vacancies and turnover across the organization. These round-the-clock jobs are difficult ones in the best of circumstances. The layering on of the pandemic landscape has caused already high turnover rates to increase sharply. DYS has 3 cores: our Youth Services Administration, our Youth Treatment Programs, and the Juvenile Court Diversion Program. The Governor's recommended budget for fiscal year 22 is $59.6 million and 1,087 FTE. On page 2 is the youth administration budget. The governor's recommended amount is $2,039,000 FTE. Youth Services Administration provides funding for our central office and 5 regional offices located across the state. Our central office includes program development, human resources, fiscal and budget administration, professional development, interstate compact for juveniles. We administrate the Juvenile Court Diversion Program, and we ensure compliance of the Prison Rape Elimination Act, or PREA. Our regional offices provide support to DYS programs to ensure statutory mandates are met and program services fit the need of the youth in care. Each region is responsible for the supervision, planning, evaluation, and staff training that is necessary for effective and efficient delivery of services to DYS youth and their families. In addition, our regional office staff work directly with local courts, juvenile authorities, and local contracted partners. On page 18 is the youth treatment budget. The core budget's $49.4 million and 1,048 FTE. It's a combination of general revenue, federal funds, and other funds. The main source is our Educational Improvement Fund. DYS currently operates 27 facilities offering 4 levels of care. We have 4 programs that are considered secure residential, 14 that are moderately secure sites, and 3 community-based. In addition, we provide transitional or aftercare services, including the operation of 6 non-residential day treatment centers. On page 36 is a new decision item for Raise the Age.
Representative Unsicker, you're recognized for an inquiry.
Thank you, Mr. Chair. You talked about turnover a little bit. Will the House pay plan help reduce turnover in your department, do you believe?
We do believe it will. Becoming competitive with both other state agencies as well as the private sector, the hope is that the pay increase would serve to bring at least, put us in a position to be competitive with others performing some of the same work, for sure.
How many total kids are you set up to serve?
I would have to do those calculations. We had a program reduction in the middle of the pandemic where we reduced our capacity. We let go of 6 residential programs, I think was the number. And right now, with our staffing levels where they're at, frankly, our census is down through the pandemic. Policing, courts, we've seen a reduction in the number of kids. Now, the enactment of Raise the Age has brought in, thus far this fiscal year, another 64 young people that have been served in our residential setting. So this year, we are projected to have our first increase in multiple years in the number of kids coming into care.
How many total beds do you have staffed for kids?
Presently, our total, I want to say it's, our total number of beds right now. Hang on just a second. Hang on. $500. 500. That's the number. Thank you. Yeah. 500 beds.
Are they all
presently.
full or?
No.
No.
Not presently. We've been able to absorb the Raise the Age to this point, the change in law, with existing capacity.
But you expect an increase overall because of Raise the Age?
We do. We're asking we're asking for the continued or the reappropriation of that money because there's been a delayed implementation. So in July of this year, the law was enacted. I think it took the courts a period of time to scale up and figure out. There was still a lot of, I think based on the language in the law, there were some details that had to be worked out in the court and to bring congruency about how they were going to respond from the policing piece all the way up through the court processes. So there's been a delay with us sitting at the back end of the system of young people coming into care through that. We've seen now some traffic related to that. 64 kids have come in. We project about 110 17 to 18-year-olds that may enter care before the end of the fiscal year.
I think that's all my questions for now. I'll have some later. Thank you.
Sure. So on page 36 is a new decision item for Raise the Age. In FY22, DYS was appropriated one-time funding for startup costs associated with Raise the Age. Due to the delayed implementation and other factors, DYS has seen roughly 64 17-year-olds in care since July of 2021. We are projecting this year, again, around the 110 mark, if that stays consistent. Further, the pandemic and its impact on policing and court operations has reduced the number of commitments to DYS custody. Therefore, any youth committed under the new law at this time have been able to be served with existing capacity. Post-pandemic, DYS would expect a significant increase in the number of commitments, which will require one-time funding to be used for the startup of new residential and day treatments. And you'll see, and I think we've introduced an ARPA project with a new day treatment in mid-Missouri that would expand our continuum and allow us to serve in a community-based way young people in mid-Missouri. And that would be utilizing funding through the Raise the Age dollars that were appropriated. On page 41 is the Juvenile Court Diversion Program. The overall budget is $3.9 million. That includes general revenue and gaming commission funds. This appropriation supports a grant and aid program that provides local juvenile courts the resources to create specific services or solutions for problems unique to their communities. Examples of the projects are after-school enrichment programs, youth advocacy projects, and intensive supervision programs. In fiscal year 21, 40 of the 46 judicial circuits participated in JCD programming, and 7,046 youth were reported diverted. This core provides a significant investment in the front end of the juvenile justice system, enabling early and critical interventions at the local level. It works to ensure that far more costly deep-end services are avoided. There were no core reductions recommended by the governor.
Okay, any questions for DYS? Okay, seeing none, thank you very much for your testimony. Thank you to the department for being flexible today, kind of hanging in there with us with this disjointed day that we've had and meeting here with us over multiple occasions. We appreciate that very much. So thank you all for your testimony. Thank you to the committee for your hard work. As you have probably heard by now, session is canceled for tomorrow. We will be canceling our hearing for tomorrow as well. We will need to make up the conservation hearing at some point next week, and then we need to renew our hearing on House Bill 20 as well at some point. So be looking for hearing notices for those two things and enjoy your few days of break. We are adjourned.